Thank you. Thank you.
Okay, all set.
All right, thank you, Barb. I'm going to call this special meeting of the Board of Education to order. I want to thank you all for joining us this evening. The pandemic continues to show us that we cannot take the health of our educators and their families for granted, that we as a community must do everything in our power to prioritize our schools and support our teachers. Tonight, we're going to hear from our human resources, we're going to hear from our medical experts, and we're going to hear from the community. And we'll be starting our meeting this evening with public comment. Barb, if you want to bring our speakers in, I think we have 10 public comments and then our summaries of our written statements as well.
Yes, our first speaker is Catherine Hillcove. Catherine, when you're ready. I see your mic is on, Catherine. I need your video if you can do that.
Right.
Thank you. There we go.
Hi, thank you so much. So I guess I'd like to start by saying that I'm in favor, of course, of a return on Monday or as soon as possible for students to in-person learning. I watched the superintendent's press conference, and I'm happy to know that the district understands the incredible importance of kids being physically present at school and the safety of doing so. I'd further add, though, to what was shared, that evidence also clearly shows that COVID is overwhelmingly mild in children, that we live in a very highly vaccinated community and our staff has a vaccine mandate, all of which argue for the safety of children attending school throughout the pandemic, especially given that Omicron shows that it's less severe than other variants. The question is, why are they not in school this week? And I would have to say that the district's communication and messaging about the reason for this pause in instruction and in-person learning has been very vague and non-specific. No clear reason for the break has been provided to parents, and the email from the superintendent informing us of it was remarkably unclear. Our choice as parents to send our children to MMSD schools constitutes an implicit partnership with teachers, schools, teachers, and administrators to educate our children and not being addressed as equal partners in this enterprise. That is, by not being given direct and clear information by the district, damages that partnership. It's only been through news reports and anecdotal information that it seems as though the reason for the pause is a shortage of staff due to active COVID infections. First, this does not seem like an unanticipated development. My kindergartner came home with her Chromebook at the end of her winter break, and so I knew that she was not going back. But even if the district felt that this scenario was a remote possibility, they should have begun planning for it in the middle of December and not at the beginning of January, as it seems has happened, because we haven't been given information to the contrary. MMSD is a very well-funded, community-supported, nationally recognized school district, and I cannot understand how contingency plans were not put in place at the beginning of winter break that would have helped to avoid the situation we find ourselves in now, especially as the district clearly anticipated the moment in which we find ourselves. They knew this was coming, and why are we where we are now? Each day that children are out of school represents a hardship of one sort or another to every family affected. And the way the situation has been handled by the district simply serves to reinforce the fact that as families, we cannot count on our schools to properly serve students and families. Attending school is not an optional activity for children and their families, and I expect the district to do better moving forward as we continue to navigate schooling in a pandemic. Dr. Jenkins said in his press conference that school is the safest place for children. I agree. It's where they should be. I would like you to practice what you preach and make sure that they're there. It is not safe for children to be out of school, even for short breaks, causes mental health problems and other adverse situations. So those are my thoughts. Thank you for your time. I appreciate you listening.
Our next speaker is Joshua Garoon.
Thanks. I want to start out by thanking President Muldrow and the board for giving us an opportunity to speak tonight. It's much appreciated. So I'm the parent of two 8-year-olds at Franklin Elementary. I'm also a faculty member at the University of Wisconsin-Madison, and I specialize in community and environmental health. In fact, I've conducted research and published peer-reviewed articles on pandemic preparedness and response. I've also done both research and teaching on COVID-19 specifically. So I'm wearing both of those hats as I speak to you this evening. And again, I appreciate the chance to do so. I'm going to echo a lot of what Catherine just said. Speaking as someone who is a scientist and who is asking you to listen to me, not just about the science, but about the principles and priorities that I see being paramount here, I actually don't have enough information based on what MMSD and the board has given me to pass judgment on whether the decision to return in person right now or to go virtual is a justifiable one. That would depend not only on scientific evidence, but on principles and priorities that I simply haven't seen articulated clearly or coherently, particularly over the last couple of weeks. And in this regard, I really want to tip my cap to members Carusi and Gomez-Schmidt, who in your last meeting on Friday, I think articulated the same concern very clearly. That we talk about following the science, but we don't seem to be listening to scientists, or if we do, we're not reflecting that particularly well, and we're not articulating the values that we're bringing to listening to those scientists. This is really disturbing to me. It's really disturbing to me to tune into a school board meeting on Friday as a scientist and hear Tom Friedrich, who is a colleague for whom I've guest lectured in his course on HIV/AIDS, giving a 35-minute crash course in COVID-19 and answering questions that frankly to which the answers should have been known by this board and this district already. It was profoundly frustrating to have a meeting take up 35 minutes for that sort of what I consider at this point remedial Q&A session. And this is no knock on Tom. And I don't mean it as a personal criticism of any of you. It's a question of where we are right now and why we're there. Again, I don't have the information to say next week we should be in person or next week we should be virtual. I do know, speaking to members of MTI, I'm a union member of UFAS Local 223, so these are unions, brothers and sisters, that they're terribly confused, if not outraged, by a decision to go 2 days virtual and to make the decision so last minute. They are telling me that, and I agree with them as a teacher, that this makes no sense, that this should be if not at least a week-long process of deciding week by week. It should probably be even 2 weeks or 3 weeks. But again, I don't have the information to reflect on that as a parent or a scholar, as a scientist, because y'all haven't shared that information transparently. Y'all haven't been willing to talk to us about the metrics, whether it's Superintendent Jenkins in the press conference on Friday, repeatedly fielding questions and replying that it's multiple variables, it's multiple factors, but not being willing to specify what those factors are, or whether it's the type of conversation that was had on Friday where it took 75 minutes before members Gomez-Schmidt and member Carusi were able to raise the real pertinent questions. 75 minutes out of a 2-hour session before we got to the really important questions about staffing levels, about staff analysis, about when these reports were going to come through, about what metrics were being used to assess these things. That really doesn't give me confidence in the decision making. We have to have more transparency, more clarity from the board and from the MMSD staff. I'm not saying this as a critique of the decision you've made right now, but going into next week as you make decisions about in-person and virtual for the longer haul, I guarantee you, if there's not that clarity, if there's not that transparency, if you do not take responsibility for making sure parents and the rest of our community understand what's underlying these decisions, you will face a tremendous backlash. And I, unfortunately, will be part of it after having really stood up for this board over the last 2 years. Thanks for listening.
Our next speaker is Reverend Dr. Marcus Allen.
Good evening, everyone. My name is Marcus Allen. I am the pastor of Mount Zion Baptist Church on the south side of Madison. I have a 6th grader and an 8th grader that goes to Wright Middle School. And I want to commend the board for making this decision. Preferably, it's not one that's long, but because we understand the disparities for those kids who depend on school lunches. And then we also understand the importance of kids learning better while they're in the classroom. But however, looking, we don't have to be scientists to look at the numbers that's going on and seeing how the numbers are rising in our community. I can't speak for anyone else, but me being a pastor of a church that often has large gatherings every week, we also shut down our church for 2 weeks. So we're not planning to go back in for 2 weeks because of Christmas, because of New Year's, and because not only have we seen the numbers uptick across the nation, but also in our families. Many of us who are on this call right now, I'm pretty sure, have someone who has contracted COVID over the last 2 weeks that's within our families. And so we got to think about that with our kids going to school, with our kids being out of Dane County, our kids being around other family members. And so how do we expect our teachers, how do we expect to keep them safe? So I commend you all for making the hard decision. I don't know what information you used, but it was something that you had to go by. I'm pretty sure it just wasn't Dr. Jenkins waking up one morning and say, hey, we about to close school, but I'm pretty sure it's a hard decision because it's one that I had to make myself. So I commend them for making this adjustment. I commend them for trying to keep our kids safe, and not only our kids, but they're focused on families and community because it may be a grandmother who's watching that child who will not be able to handle the stress in which COVID brings, but that child is able to because their immune system may be stronger. So I would ask, Jess, I know everyone's situation is different. My situation is totally different from any other family where my wife or myself can help our kids while they're at home. Other families don't have that. So I would ask that it not be a long pause, but I'm thankful for the pause that you all have put in place. Thank you.
Our next speaker is Floyd Rose. Dr. Rose, can you turn your mic on, please?
Okay, thank you. In the time allowed, I seek to commend the Madison Metropolitan School District Board of Directors, its leadership, Chair Ali Mudro, and Superintendent Carlton Jenkins, for their thoughtful deliberation and actions concerning the recent surge of the coronavirus. As you may be aware, social determinants of health have played a major role in the disproportionate of considering infections African-American population of our city, county, and state. African-American youth in Wisconsin under the age of 18 make up the second largest group of those hospitalized due to COVID-19 at 24.3%. As of the 1st of January of this year, African-Americans compose 8% of all COVID-related deaths in Dane County, and yet comprise less than 4.6% of Dane County's entire population. African-Americans constitute the highest rate of COVID-related hospitalizations in Dane County. And in Dane County, youth ages 12 to 17 make up the largest number of breakthrough cases among children. Note, you test positive for COVID-19 despite being fully vaccinated against the virus. I realize that it is extremely difficult to make difficult decisions in difficult times. Therefore, I so appreciate you choosing to possibly err on the side of humanity. Because at the end of the day, there is no such thing as an acceptable loss when it comes to our children and our educators. Thank you.
Our next speaker is Christian Olson.
Hi, thank you for allowing me to speak tonight. I'm the parent to two MMSD elementary school students, and I'm really profoundly concerned about the harmful impact of delayed school reopening on our community and the return to virtual learning. And I want you to know tonight that these extended closures and periods of virtual instruction are creating irrecoverable losses for my disabled child. that now span 3 years of her elementary school education. Kids with IEPs, including mine, haven't been receiving all of the therapies and access to the curriculum that they've needed from MMSD during the pandemic. And this newest decision has not given me confidence that her needs will be met. Advanced planning and accommodations never happen. Compensatory services have been practically non-existent or ineffectual. And I think this is one of the many reasons that national and international organizations, as well as influential public health officials, favor returning children to in-person school due to the continued social, emotional, developmental, and educational harms of virtual learning. I think furthermore, if you ask any pediatrician in Wisconsin, they would share with you that young people are dying at an alarming rate, but it's not from COVID. They're seeing life-threatening mental health conditions in elementary aged children. And I've seen this working at both children's hospitals over the past 2 years. We're harming our children and averting our eyes from known and avoidable dangers. Closing schools is not proven to staunch community spread of COVID. In fact, when schools are closed, we often see kids gathered unsafely. They're forced to learn in basement pods, unsupervised, or at community centers. To be clear, I am not minimizing the death and disability caused by COVID. My partner and I are in our 3rd year of supporting the sickest COVID patients, pediatric patients who are suffering from MIS-C. And we know firsthand the devastation that COVID can cause for families and communities. But as long as families choose not to vaccinate themselves or their children and refuse to practice well-known mitigation strategies, it's hard to imagine that this suffering will end. But the harms of isolation and lifelong impact of lost elementary instruction for all students is avoidable. You can and should change course, and that's why I came here tonight. I hope that you reverse your decision and return elementary students to the campus without delay. I hope that you use the resources at your disposal to create a reopening strategy that is science-based and inclusive of your most vulnerable students. And I think that you've been able to see how districts across the country, what kind of measures they've been putting in place: vaccine mandates, rapid testing mandates, free high-quality masks, incentivizing retired teachers and staff to return to the classroom to buffer personnel shortages, allowing vaccinated masked volunteers to return to the classroom for additional support, and incorporating outdoor education, which is especially effective for young learners. The questions I want to ask you tonight is, have we adequately incentivized our staff and teachers to get boosters, which is a scientifically proven measure? Can we ensure that teachers are classified as frontline workers to ensure their access to new COVID treatments? Are we paying substitutes generous wages? Can we offer retention bonuses to those in the classroom? As the daughter of a teacher, I hope that MMSD finds solutions that manifest its mission to equitable and inclusive instruction instead of falling back on closing its doors. We can keep schools safe, provide staff the resources for their work, and put kids first. Thanks.
Our next speaker is Ann Morrison.
Thank you. Thanks for allowing me to speak tonight. I have 2 kids in the Madison Public Schools, and I myself am a Madison Public School graduate. I know that teachers, administrators, parents, and children all share this common goal of having children receive a high quality education. I haven't spoken out about schools in these last 3 years, but I'm here tonight because I really feel that we are failing our children, and I encourage you to not close our schools down again and pivot to virtual learning for a prolonged period of time. We have to do something different this time. Online school is not school. It's not a substitute. We all know this. We know the remediation, or I know the remediation that our teachers have had to do to catch kids up by almost 2 grade levels this year. It's just unacceptable. If MMSD schools are not safe, I do not think you should return kids to virtual schools. If schools can't stay open, I encourage you to extend the school year into the summer months to give our kids the education that they deserve and the education in person that our teachers are best able to deliver. I really hope that schools can reopen on Monday, like some of the other speakers. I don't have all of the facts that you all are working with, but I do know we are in a community with exceptionally high vaccination rates, strong masking mandates, and many mitigation efforts. In our community, offices, stores, restaurants, bars, all the private schools, daycares, and other spaces are open. Thank you for those who are closing churches, et cetera, to help keep our schools open. I think public schools should be open too if they're able to open. They're an essential service and they should be the first to open and the last to close. I know there are folks with unique health challenges and I strongly believe they should be accommodated, but for the overwhelming majority of students and staff who are able to be in school teaching and learning, I know that we all agree that's where they belong. And then I would just ask if staffing is an issue, if masks are an issue, if carpools are needed, if toilets need to be cleaned, please empower each individual school to work with its communities so we can have the volunteers and the resources to help solve these issues. Let us know how we can help you guys get the resources to get these kids back in school. Thank you for your time tonight. I'm learning a lot listening to all these other speakers, and I appreciate you listening to me. Thank you.
Our next speaker is Pazarita Charles. Ms. Charles, I know that I saw you join just in the last few seconds, so I'm gonna give you a little bit of time. Oh, I see you here. Just turn on your video, please, and your mic, and we'll be ready to go. Okay. I'm sorry, is this Pazarita Charles?
She's driving in her carpool.
Okay,
She'll be on. Can you circle back to her after?
sure. Okay, our next speaker, Mike Marty.
Hi, I'm Mike. I have two kids in MMSD. I'm going to start out with a fact. Today, there are less patients in intensive care in Dane County hospitals than there were a month ago, and there are less patients in the ICU compared to a year ago. We know that case rates are skyrocketing. Okay, that's obvious. Overall hospitalizations are also modestly up. This is all in the data. You can go look at the dashboards yourself. Okay, Anthony Fauci has come out and said this week that kids should be in school right now during Omicron. He has also said that it is time to stop dwelling on case numbers and to look at hospitalization data. Okay. Virtual school, it's had a profound impact on the mental health of children. I know this firsthand. 2 weeks ago, I was conversing with Dr. William Taft. He is a child psychiatrist at UW Health. I predicted this. I told him that Madison's probably going to be ridiculous and go virtual in January, and he paused. He shook his head, and he had a one-word response to me, which was pitchforks. Okay, I'm glad the pitchforks are out. This is unacceptable. Your advisory group, I learned, does not have a mental health specialist. Okay, your decision-making as reported by the Wisconsin State Journal is not taking into account the public health department of Dane County. I doubt it's taking into account what the hospital administrators are saying. The job here is to make sure our hospitals have capacity and to make sure that the vulnerable are most protected. Okay, I understand that you may have staffing shortages to deal with. Your principals are up to the task. Okay, today I talked to one of your principals, and I was told that yes, we can handle it. He's like, we may have to close classrooms. We may even have to shut down an entire school. But to close down the entire district makes no sense. Okay, I personally regret buying a home in Madison. I wish I would have bought a home in Middleton, Verona, or Wanakee. Those kids are getting a better education right now. You guys are letting our children down in Madison. Okay, stop letting your kids down. That's all I have to say.
Our next speaker is, unless Pajarita Charles is ready, we can move to Shira Goldman.
I am driving a carpool right now. Can I circle back and comment like in 20 minutes or 15 minutes when I can pull over safely?
I'm sorry, I think the public appearance portion of the meeting may be over well before then, because we only have 1 or 2 speakers left, but.
Okay, I'm going to pull over right now, and I have a statement prepared, and I might not have I will turn my video on. I just need to, sorry. Yes, my name is, can you hear me?
Yes, thank you. Yes.
Okay. My name is Shira Goldman. I have 3 children enrolled in MMSD schools. We moved to Madison from out of state in 2008 and selected our home based in part by the highly regarded public school system that Madison was known for. We marched in solidarity with our teachers in public schools in 2010 during the Act 10 legislation. We supported the closure of our schools in March 2020, given all the unknowns of the coronavirus. While challenging, we also supported the decision to start the school year virtually in September of 2021. However, I can no longer support in good faith any further virtual instruction, and I'm now questioning whether we can continue to support MMSD, given the behavior, communication, and judgment that has been on display recently. We now have the luxury of nearly 2 years of data on coronavirus and its transmission. We now have research to suggest that even in areas where community spread is high, this does not translate to viral transmission within the schools when mitigation strategies are implemented. And we now realize that schools are the safest place for our children. There are 3 quick points that I want to make. Point number 1, the MMSD decision to remain virtual is putting further strain on our already taxed healthcare system. I am a PA at St. Mary's Hospital. The MMSD closure is a critical bottleneck that directly impairs the ability of our hospital to run on already thin margins. Estimates suggest that there are nearly 3,000 MMSD parents employed in the healthcare system. Your closure is forcing these parents to choose between supporting our community hospitals and caring for their young dependents. I don't know how Carlton Jenkins or the Board of Education can sleep at night knowing your decision to close abruptly like this is further straining Meriter, UW, Children's Hospital, and St. Mary's. I witnessed this trickle-down effect when I was working on the floors of St. Mary's this Monday and Tuesday. Please think critically before you make this very, very detrimental decision to our healthcare system. Number 2, kids with disabilities, and I'm echoing what the other speaker said before me. Your decision to maintain virtual education and expect that high-risk kids with disabilities and IEPs can access virtual education is not only short-sighted, it's in violation of Wisconsin state law and the American with Disabilities Act that legally ensures that all children in our state have access to the free and appropriate public education that they deserve. This is not happening, and you know it. As I mentioned, I'm the parent of 3 MMSD children, one who has significant learning disabilities, who is only in 1st grade when the pandemic started. He has limited reading skills, and we were told that as long as he was not blind or had no missing limbs, he could access virtual education just fine, and that virtual instruction was comparable to in-person. Finally, equity. MMSD likes to pride themselves on their commitment to equity and justice. There is nothing more inequitable or oppressive than keeping your schools closed and letting the more advantaged families hire tutors or outsource their kids' education to the private sector, as so many of our neighbors have already done. The hypocrisy in your commitment to equity in these circumstances is now in full display. Carlton Jenkins, you should be ashamed to represent our district at this critical moment of racial reckoning. In summary, I will no longer have my children participate in virtual instruction if it continues beyond January 10th, and I'm pleading with you as a mother, as a healthcare worker, and as someone who cares about justice to please open your schools for the option of in-person instruction effective January 10th. Thank you.
Our next speaker is Rochelle Winkler. Let's see, Rochelle Winkle-Wagner.
Good evening. My name is Rochelle Winkle-Wagner. I am a mom of 2 children in the district, one in elementary school and one in middle school. I am also a scholar of education with a PhD in education policy. I'm a professor in the School of Education, and I just want to start by saying I am a supporter of yours on this board. I worked on many of your campaigns, and I'm coming to ask you to partner with me and others who spoke here tonight and in the community to consider better solutions than virtual schooling. I'm also a colleague of some of yours on campus, and so I am trying to really honestly reach out as a partner to you and say that we need to restart schools January 10th. Your own public health scholar who visited the special meeting just days ago said that kids are safer at school. The data over the past 2 years in schools nationally, which I've been following closely as an education scholar, supports this claim. When did staff and students start to increase their risk of getting COVID? Yes, there was Omicron, but it was when they were not in school. So we also need to consider that. Many of our children, families, and communities are simply at a breaking point where virtual learning that sustains longer than January 10th is going to continue to cause harm that could be catastrophic for our community and this school district. Children's physical, mental, social, and emotional health have been harmed by sustained virtual schooling, the 288 days they've already sustained and suffered through. Physically, obesity rates are up in children nationally and in the district. In our own community, the rate of anorexia has increased by 150% just during the pandemic. Gun violence among children has also increased during the pandemic, creating more physical harm to children. Mentally, socially, and emotionally, we are also at a crisis point nationally and locally. Emergency rooms and hospitals are full, not just with COVID, but with suicide, self-harm, anxiety, and depression emergencies among our children, all of which increased during virtual schooling. Many families with children who have IEPs and special needs have had children who have not received appropriate services virtually because some of them simply cannot receive those services virtually. Children are meant to learn in community, and continued virtual learning betrays our community and continues the isolation that relates to these detrimental physical, social, emotional, and mental health outcomes. Families can no longer sustain virtual learning. If virtual learning continues longer than January 10th, many parents will have to choose between jobs, putting food on their tables, and neglecting their children because they cannot stay home with their children any longer. Other parents, those with resources to do so, some of which are already doing so, will choose between public schooling and private schooling, and that just further perpetuates our disparities. My own work focuses on race and social disparities in education, and race and class disparities have widened in our own district and nationally based on virtual learning during this pandemic. I come to you with some ideas for solutions, and I come to you wanting to partner with you. Let's stop seeing this as either virtual or in person. Offer new ways for families that desire to do so, and even teachers and staff to opt in if they are immunocompromised and simply need to learn and continue to be virtual. And let the rest of us go back in person. It's time for creative and innovative leadership, and I know that you can be the people that show us creative and innovative leadership, and I beg of you to do so. I'm happy to partner with you. Virtual learning is no longer innovative, creative. It is harmful. Let's consider partnering with UW-Madison School of Education to help staffing shortages. I have ideas with that, and I'm happy to talk to you about them afterward. Could there be floating staff between buildings to cover shortages in particular buildings for the short term? I would even recommend half-day learning to spread staffing out if that's really necessary for a short-term solution rather than going virtual. I think there's probably a lot more solutions that we could come up with together with our families and communities and with experts in the field. And I promise you that I will put together a panel of experts and families and communities that care about this district and care about our children to help come up with these solutions if you need more solutions. I'm not just coming here to complain. I'm coming to you because I am a longtime advocate of our children, our families, our communities, and of public schooling. But virtual schooling is no longer the right option for us. I want you to know that I'm in this with you. But based on the New York Times article that was just published yesterday, virtual schooling is just no way to grow up, and we need to end it. Thank you.
Our final speaker is Pajarita Charles.
Hi, can you hear me?
Yes, thank you.
Okay, great. Thank you so much. Hi, Superintendent Jenkins, members of the school board, teachers, and families in the district. My name is Paha Charles. I'm a parent of 2 students in the district, one in middle school and one in high school. I'd like to begin by acknowledging the significant challenges that the superintendent and members of the board are facing in making difficult decisions in the best interest of our families, students, and staff. This said, I would like to go on record as saying that our family is in strong support of returning to in-person learning and are opposed to the continuation of virtual learning for all students. While there may be some students who need to stay home and some staff who need to stay home, expanding options for them to do so would be in the best interest of them and other students and families. Let me start by explaining our experience with virtual learning. One of our children had a very, very difficult time with online education. He was disengaged. We could not convince him to turn his cameras on because most students' cameras were off. We sat with him day after day, trying to help him to do his work. We think he has lost, on average, at least a year's worth of education. We cannot afford to allow that to continue. But let me explain, we are well-resourced. We have flexible jobs. We can stay home. We can monitor him and our other son. We can make them lunch. We can take off work to pick up lunch, food if we needed to, instruments, materials. We have stable internet. We even have backup computers if the Chromebook that they are given doesn't work. Not all families have these options. Why increase the risk for so many children who will end up at home without cameras on, disengaged, if they are there at all? As has been said over and over previous to my speaking tonight, the risk for many families in our district is too great to keep them at home. We have had successful mitigation strategies in place up until this point. Let us partner with the School of Education experts, along with the scientists and virologists at the UW-Madison, to come up with meaningful and effective strategies to address the challenges that we are now facing in this new era of Omicron. Please allow us the opportunity to bring our children back to school where they can continue to learn in person and in the most effective way possible. Thank you for all your work. We know that this is a difficult and very challenging time, but please allow us to go back to school. This is where our children need to be. Thank you.
Thank you. Barb,
Thank you. That was our final speaker.
Barb, you have our written summaries and our reports as they came through the WhatsApp app.
Yes, so they're in board docs. Briefly, what's there is a summary of the written statements that were submitted via the board website, including the full statements themselves. Also the dialogues that we gathered from the Let's Talk model, especially over the winter break, are included here, and those are summarized as well. There's also just a short public input report on the emails that came to board at Madison and the topics from the messages that came in from the written statements. So those are all here. I can share them, or it was just really information here for the board to see. All of these original messages have been shared with the board through their email as well. So this is just documenting everything that we have gathered from the winter break through the first of the year here in all the ways that we do this.
Thank you so much for that breakdown of the written summaries, as well as the other tools we use to gather community feedback. Board members, I'm going to move us through the agenda to the presentations from our administration. We'll have a chance to respond to these presentations, but I'd like to turn it over at this time to Dr. Jenkins.
Okay, thank you, President Moultrie, and let me also say that I really do appreciate the comments that came in tonight, the emails that's been coming, the number of conversations we've been having with our staff as we've gone out over these past couple of days, as we paused, and just the parents that I've talked to on the phone. This is critical as a part of our process as we're continuing to make sure that we involve our stakeholders in our conversations. The metrics meetings that we've had and we continue to have every Tuesday have been very important as we continue to look at what CDC's presenting to us as a nation, what our health department has done for us in the state, and also public health. And we are following that closely. And this is difficult. Let me say that to all parents who presented tonight. We totally understand where you're coming from. There's much research that has come out that is science-based, and even sometimes now conflicting between what's at CDC and what's happening at the state level, what's happening at the local level. And the social emotional piece, and some of the parents spoke to that tonight. All that's a part of it. We came back to school fully in the midst of 2 pandemics, and this is real. The health part is serious, but also the social emotional and the mental health piece. That's very serious. Our staffs across the country are facing all kinds of shortages, but it's not just the shortages. It's the social emotional piece. Staff are seeing things now that they have not seen in their entire time. My 32 years, I haven't seen it. And my colleagues, as I speak to them. So it was multifaceted, as stated. I think our own medical advisors and the research clearly says that students are better in school. We've said that since day one. We wanted to pause, give our staff coming back from break, knowing the potential spread of the virus. Yes, Omicron, some saying not as harmful as COVID, but it's harmful. Our commitment in our district is to return every student back home safely. Will individuals get sick? Yes, but we want to minimize that. We want to put our students in the best learning position. So we have a presentation for you here tonight, and the point of this meeting tonight is to hear, like we did. We heard from the public. We're going to hear from our board members tonight, and we're going to continue to move with our cadence, and some information perhaps can be communicated differently, but this wasn't just a one-time move just to move. We know that our children are better off and they're safer. Everything about the research says that they're better off in schools, but we need to do schools right. And let me just say, children were being harmed before we went into the pandemics. Okay, let's be clear about that. In particular, when people conveniently talk about Black and brown children, let me represent that, and students who with disabilities, because I've been in this fight a long time. The pandemic has given us an opportunity to really look closer at what we need to do. But you know, it's been changing rapidly, minute by minute, hour by hour, day by day, week by week, month by month. And if someone would have told me that Omicron was coming on as we were preparing for COVID-19, I would have been happy to take that information. But as you know and I know, Omicron came on and is transmitting much faster than what we have seen. I was that superintendent in Minnesota that closed schools first. And when we first saw that communication January the 28th after Kobe Bryant was killed in a helicopter crash, we did not even know what Omicron was, what COVID-19 was about. We actually thought if you just touch someone with your hand, you can get infected. We have learned more now than what we've ever known about COVID. So we do have a belief system that if we're doing the mitigation strategies, we can get back in school and stay in school. What we have learned, my colleagues and I, opening schools and closing schools is also devastating to our students, to our staff, and to our families. So tonight's presentation, hopefully we will find ourselves more comfort in what's being stated. And also we're looking for and anticipating having a great discussion with you as a board, because we know that this is a very serious thing that we're dealing with. And I hope that we as a community can find a way, as one of our partners said, to come together. Let's do this thing together. We have to. We can't do it in isolation. So having said that, at this point, I want to start with the PowerPoint presentation and give our staff an opportunity to speak out to you as a board. Many of the things that we've done, and we are participating in a collaboration with ABC collaboration with Duke University, University of Wisconsin, meeting with our medical advisors, which I would like to have them go in just a minute after I say this piece here. But this meeting is a special meeting to give our opportunity for our community to come in and speak, and for our board members to hear us clearly, and for us also to hear from the board so that you can weigh in on our path forward. Next. In our district, we're very serious about this piece. Every school will be a thriving school that, that prepares every student to graduate ready for college, career in the community. This is a very serious community situation that we're dealing with now, that we know that's not just locally, statewide, nationally, but it's global. So our students are getting an opportunity to learn in different ways. And I think that we all can come together to ensure that some of the things that we consider to be losses, that we can work on that. But we also have to acknowledge that there has too been a lot of learning occurring. And I thank our students for being so resilient, our staff for being resilient, and our community for the way that you've stepped up and supported during this time. But I realize that everyone's getting tired. The social emotional piece is serious, okay? Not just in schools. I'm talking about to our colleagues and to our family members out in our larger community as well. So the timeline for which we've been looking at this whole COVID-19 ever since the beginning of 2020, but I think even when we started talking about COVID in August, after we came back, of what could be our various scenarios, we had no way to plan for, as I mentioned earlier, the Omicron and how fast it would move, how fast it would spread. But we thought about we had several scenarios. And as you see, as of recent, since we've made our decision, other districts have also followed, not only just locally, but on a national level. But our whole intent, as we said during the press conference, if you go back and look at it, was to pause, to address the socio-emotional well-being, to also pause and think about some of the choices based upon the impact that the virtual school has had and our students coming back in the middle of a pandemic. We wanted to make sure we had a better grasp ending right before our winter break. We wanted to come back more thoughtful if we have to go to another situation in terms of virtual or another form of learning. And we stated that clearly. This is the timeline. You can look at it. Dr. McGregor is going to roll through the timeline, and then we'll come back with our experts also. Dr. McGregor.
Thank you, Dr. Jenkins. Yes, our timeline is pretty straightforward. On last Thursday, after looking at the available information, we announced a pause on our return from winter break. We did have a press conference to answer some questions that were burning from the media as well as the community. We had a special Board of Education workshop on that same day. This week we've been on our winter break pause, Monday through Wednesday. Our staff has been working diligently in buildings, preparing for not only the virtual learning that will occur tomorrow and Friday, but also reviewing mitigation strategies, following up on some students who have been disengaged, and a variety of other activities in preparation. On yesterday, we had the metrics meeting where we had a chance to hear from our health advisors. We had opportunity also to really interrogate the available information with our staff, with a few board members, with the health advisors, as I said, and really get a chance to go back and forth, so that way we could all try to have a common understanding. Today is right now it's a special board meeting, and we anticipate making an announcement on tomorrow, and like I said, we have the virtual learning, which is occurring on Thursday and Friday. From here, we want to have district updates, and so we will have different district administrators and particular departments that have an opportunity to, we can go to the next slide, Barb, have an opportunity to share out, and then we go from there. And so we will begin by having Dr. Leah Esser will come next. And we go to the next slide.
Good evening, sorry. Technical difficulties. Good evening, everyone. Thank you. Thank you, Dr. McGargry, for introducing me this evening. I am pleased to be here again with Nurse Carrie Stamfley and Dr. Kristen Getchell, Coordinator of Mental Health Supports. I'm going to kick us off, and then I'll turn it over to Carrie, who is going to get us started with our current community and school metrics. From there, we'll talk about vaccination, testing, and a variety of other topics related to COVID-19. Carrie, if you want to go ahead and get started, you can take it away.
Sure, thank you. So the first metrics I just want to report on is just in our community. We have been watching and following throughout the COVID pandemic, our 14-day case rate. Prior to us leaving for winter break, the case rate was roughly in the 200s. On December 26th, it increased to 348.1. On January 1st, it doubled to 673.2. And then when we look at the public health dashboard today, their weekly 7-day total is now at 1,198.3 cases per 100,000. In the past week, the percent positivity in our community is at 18.4%, which is really telling us that we need to do a better job at testing and finding the positive cases. We know that our hospitals are consistently running at or near capacity, and that most of the people that are admitted to the hospital are unvaccinated individuals. For MMSD, just looking at our numbers here, the dashboard has been updated with data through Sunday, January 2nd. For our totals for Monday through today, we are still working on positive cases today, so this is just a very rough estimate. But on Monday, Tuesday, and Wednesday, we have had 330 positive tests in MMSD, and about 40 to 50% of those are staff. With that, we have continued our screening process as we have always done. So we have a screener that goes out to all of our staff and our students every day, and we've continued to monitor that over break. This week so far, we are averaging about 175 people completing that screener, and about 80% of those are our staff. And so, which is something that we expected because we don't have students in our building right now, but there is a large percentage of our staff that are filling it out, reporting either symptoms of COVID, either being a close contact or testing positive for COVID-19. And that's the end of my update.
Great, thanks, Carrie. I'll talk a little bit about vaccination and then I will turn it back to Carrie for quite a few other updates. As the Board of Education knows, staff were expected to be vaccinated by November 1st. Those who were not vaccinated or exempt were put on administrative leave on December 7th, and those that did not get vaccinated were terminated effective December 21st. As of December 28th, we terminated 79 employees. However, I will tell you that there have been additional folks who have been on, have had extenuating circumstances and not been checking their email or their mail, such as substitutes who have reached out after the fact, and we've been able to reinstate them because they are in fact vaccinated. So that number is actually lower than what is represented here. Of those folks, I can report that 62% were substitutes and 15% were MSCR staff. The rest, the numbers are less than 7, considerably less than 7 by employee group. So I can't report on those specifically, but can share that they were made up of athletic coaches, LTE employees, educational assistants, food service, custodians, and teachers. Human Resources will be posting those positions, and we are working on filling those in the very near future. As we proceed, we will be working to ensure those employees who had 1 dose of Pfizer or Moderna have completed their 2nd dose. So confirming that. Following up with any employees who had errors in submission, such as date of birth or mismatch of name, and verifying the vaccination status of any employees hired after November 1st. So there will be another just group of people that we have to work to verify, and then there will be a systematized, or we are developing nearly completed a process where we are able to verify before an employee even starts at their work, so that we're not having to be in this sort of backlog situation. So in general, we're very pleased and very grateful for our staff and their willingness to get vaccinated and submit that information to us. Carrie, would you like to speak a little bit about student vaccination, and then you can continue with your update?
Great. Thanks, Leah. So in regards to student vaccination, we're proud to continue to hold our vaccine clinics. We also expanded those to include booster availability for our staff and students that are eligible for booster shots. This week, we held a clinic at Lincoln and Nana, and we will be doing a New Mundo. In the next coming weeks, we're also going to be hosting clinics at Kennedy, Lindbergh, and Hawthorne. We continue to monitor those signups for those clinics, and we adjust and open slots as needed. As the demand is there for more booster shots, we will be opening more slots if needed as well. And so we are really excited, and we are going to continue our slow process of continuing to offer vaccine clinics for our staff and students. The next topic I'm going to talk about is in regards to masks. And everyone is seeing that the new variant really does demand diligent masking by everyone. And it really is important that everyone has a mask that fits them well. And we've received lots of questions about the types of masks and what type of mask to wear. And my recommendation to everyone is the best mask is one that fits you well, covers your nose, stays above your nose, and fits around your chin and fits snugly to your face, and that you're able to keep it on for an entire 8 hours. It doesn't do you any good if you have a really high filtering mask and you need to take it off every 10 minutes to be able to breathe and feel comfortable in it. And so that is what the best fitting mask is. We are going to continue our same masking strategy as can be, as we have. We offer surgical masks to all of our staff. We have also purchased additional surgical masks for children as well. So if families are wanting their child to upgrade their mask from a cloth mask to a surgical mask, we will have those available on site as well. We also, when we have children that are sick in our building and are accessing our health services offices, when they enter into our care space for them, we switch out their mask into a surgical mask at that time for them. So we are going to continue that process. A lot of people have asked between KN95, N95 masks, and we are really following what UW is doing for practice there, in which making sure that we have surgical masks that offer the same level of filtration as a KN95 mask, so that we have those available for all our staff and students. The next big strategy that we're really focused on and has been one that has been a little bit more challenging in the recent weeks is our testing strategy. And so we have been very blessed to be able to work with COVID Clinic. They are our testing in schools partner. We have over 30 sites open in our district to be able that can offer rapid antigen and PCR testing at our schools. What we saw over winter break was a sharp and dramatic demand for testing in our community. And our COVID clinic responded to that and offered extended hours when very few other places were in our community. And they stayed open for us on Thursday, Friday, Saturday, Sunday over the weekend. And we were able to do a large amount of testing. Unfortunately, the supply chain for rapid antigen testing has been very volatile. It has not been a steady stream. And we started off our week with only having 3,000 rapid antigen tests. And by the end of the day on Monday, we had used half of those. We did receive a shipment. We have 15,000 rapid antigen tests that we can use. Unfortunately, they have a very short expiration, so we need to use those within a week. We have all of our sites up and running, and we again have asked our COVID clinic staff, and they have responded. We are going to have 6 sites that are going to extend their hours and remain open through the weekend. So on Saturday and Sunday, we will have 6 sites throughout the community that will be open from 8 a.m. to 5 p.m. And those sites will be able to offer rapid antigen testing and PCR testing at those sites. We continue to work with our partners around testing availability and supplies, and we are assuring that we are going to have testing available at some level at all of our sites in the coming days. One of the things that we are really looking at, and that this week gave us time in health services is to really look at how we are doing contact tracing. We are very proud. My nurses and nursing assistants that work with me have done an amazing job. They work tirelessly every day, putting in very long hours to assure that we are doing our contact tracing to the best of our abilities. And we know with these increased volume that we are not going to be able to continue to do that level of contact tracing. Our local public health department and many other school districts have given up on contact tracing long ago, and we have continued to do it, and we have gone above and beyond consistently. But we know with this high level of testing that we are having, if our schools are open and our buildings are open, our first responsibility is to our staff and students that are in our building and to making sure that they're safe and addressing any of the illness that is happening in our schools. And so we know that we are going to have to shift to a different level of contact tracing. And we have been working with our local public health department and our medical experts to really define how and when we are going to need to make that shift. And unfortunately, as in health services, as with everyone is experiencing, we too are not immune to the COVID virus. And we will have some of our health offices will be short-staffed starting on Monday. And so we are working diligently to make sure that we have coverage in all of our health offices for when we reopen schools. But it is, we are going to be down staffing in regards to if we look at reopening our health offices. There also has been lots of talk around the CDC recommendations in regards to isolation and quarantine. And I think one of the important things to note is when CDC first released that guidance around isolation and quarantine, it was not open to all sectors. They really opened it to the general public, but they did not change the guidance for school. They have, as of today, just released guidance that they are changing that to include schools. And our cadence has always been through this pandemic that we wait for CDC to make their guidance. We allow DHS to review it, DPI and our local public health agency to review that guidance. And then we take it to our metrics and our medical experts and discuss it as a team and really discuss about how are we going to implement that and what are the potential things that we need to think about after implementation of these guidelines. So as we go, we were told just a couple of days ago by DPI and our local public health department to pause on making any changes until they are able to update their documents, and they are doing that. And as soon as they do that, we will take it to our metrics team and look at revising our isolation and quarantine guidance. But until then, we are going to continue with our 10-day isolation and quarantine recommendations that we've been following all along. And that is it. And I'll turn it back over to Leah. Thank you.
Great, thank you. I'm going to switch gears really quickly to social emotional learning and mental health. And I appreciate the board letting us toggle back and forth between our two issues as we want to build this conversation. So as a team, we continue to center social emotional learning and the mental health needs of our students and staff as a result of the pandemic. As I shared earlier, joining us this evening is also Kristen Getchell from our mental health, our coordinator of mental health. Throughout the pandemic, we have taken our culturally responsive and trauma-informed approach and led with predictable routines, strong communication, and relationships. And we will continue to do that, whether we are virtual or in person. Regardless, it's critical we focus on the following: predictable routines. So supporting our schools to teach and reteach developmentally appropriate routines and expectations in all school settings. This includes when we return in person or even before, reteaching and recommitment to mask wearing, proper mask wearing, masks that fit and that stay over our noses. It also includes specific SEL lessons, social emotional learning lessons around dealing with change and continuing to navigate a global pandemic and a second pandemic of racism that our community is experiencing as well. I'd be remiss to not say that. Additionally, we will help our schools to focus on strong communication, student and staff supports along, including universal coaches, mental health coaches, and our intensive support team will come alongside our schools and problem solve and triage as needed. This support includes facilitating culture and climate visits that allow schools to reflect and adjust their practices to best meet the social emotional learning needs and mental health needs of their students. It also includes behavioral health in schools, which is our Tier 3 mental health screening and practices, and any individual behavior support planning that we need to do in partnership with schools. Finally, we will continue to center relationships, whether we are virtual, whether we are face-to-face, always. Relationships truly are everything, and it is what our kids need. Being in relationship and being in community with each other is paramount. Many new students and staff have had a tremendous challenge this year, specifically learning their unique needs and how to better foster engagement and connection. So as we center belonging, we will work with our psychologists, our social workers, our counselors, our PBIS coaches, and our BEAs and our classroom teaching staff to support students and to provide additional resources around social emotional interventions, mental health, referrals, and support. Lastly, I want to just reinforce, Dr. Getchell spoke about this last week. One specific strategy that the board has been supportive of is our work with Care Solace in order to get mental health resources as quickly as possible to our students, staff, and families. Care Solace is a resource that ensures our communities can access reliable and ethical and high quality mental health services no matter the circumstance. So ultimately, I will leave you with this. In order to learn, we need to feel safe and we need to feel seen. As we return, this is exactly where our focus will be, creating safety and connecting with students to best meet their needs so they can best attend to their learning. Thank you.
Dr. Esser and Nurse Carey, thank you so much for that presentation. There were two things there that we addressed. Looking at the health side of it from the medical, the science piece, and then also talking about what we're trying to do with student services, this pause that we've taken. We're coming back with that relentless focus on trying to make sure that we're looking at the social emotional and mental health side of it as we're following the science. A piece of pausing also was to allow us as staff, be it the teachers, the administrators, central office, all to really focus in on those things that we're seeing different in the midst of a pandemic, coming back to school in the midst of this dual pandemic. When you talk about the science piece of it, and then there's the social justice piece. One of the parents mentioned that early, but it really is something that we have to focus on, because being in isolation so long did too, in our estimation, harm our students when they're in isolation. We know that, but now we're trying to understand, how do we respond to that? Do we have all the answers? If you look across the nation right now, you're seeing an increase in several areas because of some of that isolation. And we came back and wanted to pause, make sure we get back in school and make sure we do it in the right way, focusing on our students, focusing on our staff, social, emotional, mental health, well-being, okay? And that leads us to next, our continuity and an instructional plan.
Dr. Jenkins, do you mind if we pause here for a moment to talk through questions the board may have around our support for students' mental health, as well as any questions folks have around testing and some of the other information we were just given? Board Member Vandermeulen.
One comment and then two questions on testing. My comment is I thank everyone for speaking tonight. But when we're referring to something as a mild disorder, we have to realize what is mild to one person isn't mild to someone else, and that it can be life-threatening. And I think we can't lose the fact that there are people who it can kill. And I don't think we need to be short-sighted on that issue, especially when it comes to disability, because we've learned that right now, everything we do in school didn't work before. We're trying to make it a fair and equitable society, but it wasn't fair and equitable before. We're trying to make it better, but we need grace just as much as we need time. As for my questions, with the testing, because I know the tests don't last as long, will we have a steady supply of tests? And my second question, and I don't know who answers it, if this is Leah or Carrie. Secondly, where are we on the COVID pay? Because I know people are very nervous about that, on the sick days and how long they need to quarantine.
Nikki, I'm going to ask that you save your second
Hold
question
that one
for human resources, but I think that'll be addressed momentarily. And then I want to say I really appreciate your question about a steady stream of testing. I heard that we got 15,000 tests that will last about a week. Will we see another 15,000 tests next week? How are we managing to continue testing folks, especially as we move towards returning to in-person learning?
I'm going to have Nurse Carrie speak to this, but let me just say, first of all, as we've been going through this, work together in this pandemic, no different than in the past. We had community partners stepping up and really trying to support us. And what we feel really good about this time, last time, the federal government, the state, and just at the county level in the schools, we were a little bit disjointed. But even like now, we see our community partners. We had the Boys and Girls Club, Michael Johnson stepped up, working with the governor's office and DH, and Nurse Carrie can take it from there. But we were very concerned about the shortage of the test. And Nurse Carrie, I don't want to steal your thunder, but go ahead and talk about it.
Thank you. So we have been assured that we will have, we won't have a supply chain issue with the PCR test. So we are currently ramping up our order so that we will have consistent and access to PCR testing. It's the rapid antigen that is a little bit more volatile, and that is happening nationwide. It is not to a fault of our COVID clinic. It's not a fault to our DHS. It really is just a volatile supply chain that is coming and everyone is experiencing nationwide. And so I think DHS has assured us that they're working on that to try to stabilize that supply chain and broaden maybe to a different type of rapid antigen test that they are using. We are also looking into purchasing some rapid antigen testing ourselves so that we have a steady, consistent supply as well. On hand if needed. So I think, unfortunately, this is going to be an unsteady supply chain of the rapid antigen, but we will always have a consistent supply of PCR testing is what we've been assured with. What I will say is, obviously the PCR Obviously, we don't get the rapid test results with that, but as the volume of PCR testing being done, that could have downstream consequences. Obviously, we could very quickly overwhelm Exact Sciences if we're doing 30,000 rapid or PCR tests on a daily basis. So just being really thoughtful and diligent about that. We are having very frequent meetings with our COVID clinic staff to check in on their availability. They too continue to struggle with staffing, but they have called in people. We actually have people staffing our clinics from all over the state. They really rallied their crew and were able to provide us with a high level of staffing. So we have 40 people from COVID clinic that are testing this weekend. And our plan is we will meet every Tuesday and look at the weekend and the needs for the weekend and be able to set our clinics and expanding opportunities over the weekend for as long as this demand for testing continues.
And this is fabulous. Yeah, this is fabulous and new for us, Chair Mulder, from the other members of the board, because this isn't something that we had as a tool in our toolkit as we were going through COVID the last time. And when we say we want to get back in school and stay in school, this will really help us. And in our strategy to be able to close classrooms as we did with MSCR in the past, or close down a school, just looking at all this, these are things that we're still considering and planning for now. So that's big, the testing piece for us. It's not necessary that we have to have it, but it makes us be in the best position. I put it like that.
Board Member Castro.
Thank you. Yeah, I really just have two comments looking towards the future in terms of supporting students' mental health. I would definitely like for us to take an analysis of our pay rate for our school psychologists and school therapists. I know that we're in a national shortage of darn near everything, teachers, school staff, everything, including school psychs. And so I would like for us to look at a plan to attract and compete for more school psychs in our district. In addition to that, provided that conditions are safe COVID-wise, looking for in-person experiential learning opportunities for students to learn with peers to improve peer-to-peer bonding in the future, especially once the weather improves, but even indoors to just move beyond just sitting in a desk, but for peers to bond with one another as well.
Thank you so much, Board Member Castro. I've been alerted that our medical experts are on the call for just a brief bit of time longer. Do we want to dive into the portion of the presentation that includes them and return to questions? All right, thank you. We'll get started with the presentation again.
Instructional continuity, that's where we're supposed to be next. But before we go, do we want to have the medical advisors, your question, President Mulcher, speak at this point to some of those first two presentations? Dr. Demiri and Dr. Wall, I think, are here with us.
So do you want the medical advisors to just be available to the board right now for questioning outside of the presentation?
They can be, if they could be here that long, but I think the first two pieces there, did anyone have any questions around the science of it, the medical piece that was presented by Dr. Esser, Nurse Carey, on either side of it, or with the mental health piece of it, socio-emotional piece?
Board Member Gomez-Schmidt.
Thank you. I guess one of the questions that I have is around testing and our testing strategy now that we have gotten 15,000 additional rapid antigen tests. But I guess the one comment that I want to make, first of all, is that I really think that the biggest mental health strategy we can implement right now is to return our students to in-person learning on January 10th. When we're talking about like broad overall mental health strategies that we can implement. It's just what I'm hearing from the community. It's what I'm hearing from parents, what I'm hearing from students, and from teachers too. And so I guess what I would like going narrow into our testing capacity and the vaccinations. I guess what I'm curious about is, do we have a plan and strategy, given that we have these new tests, to do a test to stay option for our staff starting right away? And do we have additional guidance for families, students, staff as to who should be coming to our sites to get tested? Should it be everybody? Should it be people with symptoms, people who have been exposed, or what? Is there a new strategy in place for that?
That's actually a great question, and both of our medical advisors are here, but Nurse Carey could also speak directly to that.
So for the rapid antigen test that we got, unfortunately, they have kind of a short expiration. So we need to use those like in the next week or so. And we think the demand is there. And so we're really opening up testing, but we still really strongly encourage anyone who is having symptoms of COVID-19 to please go get tested. And we also are encouraging anyone that had an exposure to somebody who tested positive or is concerned about a potential exposure to also get tested 5 to 7 days after that exposure as well. So that will be our consistent message of who we are prioritizing testing for. Always. That's going to be our baseline. Those are the most important people to prioritize. But we also know we're coming off a time where a lot of people chose to gather together and to maybe have a higher rate of potential exposure. And so really trying to assure that everyone that wants to and feels like they need access to testing has that ability for this week.
Okay, thank you. And I appreciate us having all of these testing options available for families and for our community. I guess one of the questions that I have for Dr. Demary and Dr. Wald is this impact that closing schools has on the health and the medical community. I know one of the things that I've heard from people is that if we close down, we're keeping our community safer. But from the aspect of medical facilities that are having staffing shortages themselves, we depend, a lot of medical workers depend on having their students in our schools to be able to work. Can you explain that a little bit, or what you're seeing?
Maybe I can just lead off. I think that you identify a really important issue, and that is that a lot of our working staff in the hospital have young families, and they absolutely depend on the fact that their children are in school. And so when those children aren't in school, it's a big burden, and especially a burden under the current circumstances in which our staffing in the hospital, like staffing in the schools, is really short and under a lot of stress. And so I couldn't agree with you more. We want those kids to be in school, which is in the interest of their emotional and mental health, as we've said numerous times, as well as their education. And we also know that that will enable our workforce to be more efficient and effective.
Thank you, Dr. Waltz.
Board Member Gomes-Schmidt, do you have more?
No, it was, I guess it was just more around the testing strategy, if that had changed, and then I guess the ripple effect of our decisions and how important it is for us to get students back to in-person learning. Thank you.
Thank you, Board Member Gomes-Schmidt. Board Member Carusi, and then Board Member Vandermeulen, I see your hand.
Am I in the queue?
Yep, I just said Board Member Castro, I'm sorry.
Okay. Yeah. I just want to make sure that we're on the same page with Board Member Gomes-Schmidt in terms of supporting students' mental health in person and school requires a healthy staff to provide that support that aren't burned out. On the question of childcare for essential workers, Dr. Jenkins, are we still planning to have MSCR cares set up still?
Yes, that's a great question, because I've not only been working with our own staff, because as we're going through this, again, we realized from the last time we needed to have more coordinated effort with the entire community. So I've been in conversation with the mayor, been in conversation with the Boys and Girls Clubs and other individuals, and we're going to meet with our childcare providers in the community. First of all, we want to get back in-person learning. Part of that, what happened the last time, we went into a crisis mode because we just not had, as a country, we didn't think out as the world fast enough. COVID went faster than us. So now having lessons learned, we're putting all of that together in place. But so yes, we've also thought about first responders, as I'm talking to community partners, about having childcare paid for. But this is not something just the district pays for. This is something that we have to look at as a community. And I heard Dr. Wall loud and clear, along with some of my other medical colleagues there at the university, speaking about this particular piece, childcare. So that's a big piece for what we need to do together.
Thank you. Yeah, and just want to reiterate my previous comments about having school staff that are sufficiently healthy, and acknowledge that we've had students experiencing pretty difficult mental health challenges amidst both pandemics that we're in right now. Thank you.
Yeah, and if I may add the last thing, we also had to be concerned about our staff with their childcare going back in. That was a big part of it the last time as well. And this time, there are things that we're even more flexible on than we were the last time, because we've just lessons learned and we're working through this. We're co-creating where we are right now and the plan moving forward.
I'm going to ask that board members ask questions specific to the medical experts who are exiting the call. Dr. Jenkins, who are the medical experts that you said were going to be exiting the call after this portion?
After this portion, they had limited time. So I just asked if Dr. Wall and Dr. Demiri, if they were going to be able to stay with us a little bit longer. I haven't gotten a response back, but you all can speak for yourselves now.
So I'm gonna call board member Vandermeulen and board member Pearson. Then I'm gonna add myself to the deck to speak specifically to our medical experts. And I hope that board members will be mindful of the time folks have to be with us this evening. Board member Vandermeulen.
Yes, Dr. Wall, Dr. Demiri, I hope I'm pronouncing that right. Thank you for being here. My question is on in-person learning on individuals with disabilities and health concerns. What is the risk if we send everyone back with children who have special needs? Will this increase the danger for them?
Yeah, perhaps I can address that. And thank you for the question. One of my colleagues and I have been researching this topic statewide with families with children with complex medical issues, including disabilities. And one of the things that we found is that parents of those kids really want to send their kids to school, and they want to have a sense of security that their children are going to be safe at school and receive in-person learning, just like some of the parents have told us in the comment section. And one thing I think we can say is that for all children, and including children with disabilities and complex medical conditions, school is a safe place for them. And we said this, on Friday as well. Most transmission that occurs to children occurs in the community. While some transmission can occur from student to student in schools, that is much less common than, say, from a household family member, where it's more common. So the safest place for kids to be is in school. As others have mentioned, in terms of their mental health, we know that being in school is the most important component of their mental health during this pandemic, and a large contributor to many of the mental health problems we have been seeing at UW has been the isolation that has been prominent through the pandemic. But with that said, I can say that I think we can be confident that children can be safe in our schools with appropriate mitigation strategies, and many of the mitigation strategies that we've put in place have allowed us to be safe for the first 6 months of the year already. I will also say, I think we're in a very different position now than we were a year ago. We know a lot more about school health and COVID in schools. And the science has really contributed to our ability to keep kids safe in school.
And may I ask one more question, President Moultrie? On the masking strategies, what advice do you have on those kids who cannot keep a mask on, who are in special ed, who cannot keep a mask on how to mitigate it to keep them as safe as possible?
That's a great question. And, I want to quote Nurse Stampley that the best mask that someone will wear is one that they'll wear as much as possible. And so, creative options where masks that are more comfortable can be worn, face shields can be worn in a situation where it's not possible to keep a mask on. And so there are, different strategies that can be used that teachers and special ed students can work with students on.
Appreciate that. Thank you very much. Dr. Wald, do you have any suggestions?
You're on mute.
Dr. DeMurray is really the expert on this. He's been working with a group called the ABC Collaborative, which originates from North Carolina, and they've been studying this very issue. And at our own center, we have been looking in particular at children with medical complexity and those who have disabilities. And so I think when a child can't wear a mask, then we just want all the people around them to wear masks, and we do as much adaptation as we can to keep them safe through distancing when that's possible.
Thank you. That really was helpful.
Thanks.
Board Member Pearson.
Yeah, thank you all for joining us. And my question is just more so around, so we've learned a lot from the past couple of years about COVID, and as you guys mentioned, working on it about like how we know more now about how to safely keep schools open than we did a couple of years ago. I guess my question is around the fact that with CDC guidelines nationally changing to the point where decreasing time for isolation, decreasing time for quarantining and such, with the changing of like when to get tested and such. Have you guys did extensive research about how that would affect the future of how schools are open? Because basically we know that schools are safe now because, previous guidelines were in place and people were following them. So is there any research to show that schools may be unsafer based off of the change in how we're now doing those things based off of CDC?
It's a great question. And, I could answer it by saying there isn't yet, because the guidelines, they really just hit, in the past 24 hours or so. And they are based on, I think, the best science that the CDC has. And we will be reviewing them extensively. And as Nurse Stampley said, digesting them along with the State Department of Health and a local health department. I don't expect a big change in outcomes, I think. We do know that really the most intense period of contagiousness is that first 5 days, and that's what the guidelines are based on. That combined with the fact that the policies don't change too much for vaccinated people. And we suspect a high percentage of the student body is vaccinated. We know a high percentage of the staff are vaccinated. Large percentage of Dane County people are vaccinated. So it really ought not to have that great of an impact. That would be my prediction.
Dr. DeMurray, could I ask a question here real quick for both medical advisors to speak to CDC when they gave the recommendations for 5 days? That did not include schools. We were still at 10 days and the guidance just really came out. And that caused a little confusion in the community because people thought that we were not following the science of it. But if the science CDC said 10 days still for schools, could you speak to that in your response, please?
Yeah, I would just say that today they actually, did indicate that the new recommendations also apply to K through 12. And that, is why Dr. Demori said we need to all sit together and wait for DHS and Madison Public Health to render their opinion and to then talk amongst ourselves. But I think what makes me feel confident is, again, our participation in that ABC collaborative, because what we're doing is we're tracking the data in the MMSD schools. And what we're looking at in particular are the number of primary cases. These are cases of children who come into school from the community who are positive for COVID. And then most importantly, we look at secondary cases, and we try to tell as best as we can which of those secondary cases are acquired in the school, or sometimes, of course, they could be also acquired in the community. And we have data on that from the September through now, and we will keep tracking that. And we look at that every week. And so if there is a change, and if the number of secondary cases increases, then we have to ask the question, why is it? And we would be able to look at what are those things that we've changed. And then we just back off any changes that we think may have accounted for that increase in secondary cases. So I think we're in a very good position because we're so actively monitoring what's happening.
Board Member Pearson, do you have follow-up questions?
I guess just my last question, Dr. Demiri and Dr. Wald, if for people in the community who have not heard from you all, can you just state like who you are, just really quick, like what your background, I guess, just so that folks in the community know exactly where you're coming from and it's not just, random health professional somewhere. Thank you.
All right, I'm not a random health professional. I'm the chair of the Department of Pediatrics. I trained in infectious diseases in pediatrics, pediatric infectious diseases. So COVID is right up my alley. And I've been doing it for 50 years. Don't tell anybody that number.
And I'm Greg Demuri. I am a professor of pediatrics, and I'm a pediatric infectious disease specialist as well, trained in infectious diseases. And I've been the advisor, medical advisor for the school district for about 25 years.
Thank you.
Thank you.
I wanted to ask very specifically, and I want to start by saying I fully support our return to school on Monday, January 10th, and us doing everything in our power to get young people back to in-person learning. However, I think that there's a balancing act that we have to do in terms of taking this recent surge incredibly seriously and refusing to ignore it, and prioritizing getting kids back to in-person learning because it's what works best for so many of our students. I think in part of that balancing act is to consider how we navigate recreational opportunities for students. And so we've talked about our mitigation strategies to keep kids in school. I think looking to what does it mean? We heard last year, a lot of young people saying my mental health is deeply impacted by my ability to participate in sports, by my ability to be part of clubs, by my ability to have spaces to express myself. How do we manage large audiences who come to events, who are not necessarily students attending schools, but families and friends who want to see their kids play basketball, who want to see their kids in plays? And what are your recommendations for our mitigation strategies in terms of acting as a public interface?
Sure, great question too, and a difficult one too, right? And we know that co-curriculars, not just sports, but other co-curriculars as well, are very important for the mental health and the psychosocial health of children. And I think there are a number of kind of layered strategies that could be considered. And we've already talked about some of these at our metrics meetings, everything from requiring vaccines, proof of vaccination, Mask mandates are pretty standard because we're in Dane County, so that's not much of an issue. Limiting attendance can be something that could be considered depending on the level of attendance at certain events and the amount of ability to kind of keep people apart. So I think all those things are something that could be considered. I think not having sports is a last resort, and something that we would try to avoid at all costs. But certainly looking at where transmission is occurring is important, and tracking that is important.
Dr. Demir, I hear you weighing in on whether or not we have sports and saying canceling sports would be a last resort. I really would like to hear you talk specifically to whether or not we should have parents, family members, members of the community as part of the audience for certain events, and how we should mitigate the risk of spread when we do that, right? Because those are folks that we can't necessarily verify vaccination, that creates a more complex part of the work that we're doing.
Yeah, and it's a tough call, right? Where we're at now, I think it's important to have families there and have people there. I'm not so sure that being able to enforce a vaccine mandate isn't off the table completely. I mean, yes, people can forge things, that kind of thing, but I think requiring vaccine for attendance would be something that would be challenging but feasible. And I know other organizations have been able to achieve that.
Yeah, so the requirement for vaccination and the requirement for masking could be hugely beneficial in terms of addressing that dynamic. My other question was specific to Leah Esser. I'm hearing a lot from families in the community that the mental health strain of the pandemic has been exacerbated by this pause, in part because it's been a disruption to reestablishing stability for students. When we return to in-person learning, what are our plans to, provide support to students who felt additional mental health strain? So we're seeing more anxiety, more depression, more self-harm, more suicidal idealization. How are we addressing those things and supporting teachers in recognizing when a student might need some additional support and help?
That's a great question. I will get us started, and then I will ask Dr. Getchow to jump in as well. I think the most important thing for us to think about is just the importance of being in routine and being in community. So simply the act of returning to school and being in those spaces will be of great benefit to our students, just practically speaking. Beyond that, it's important to recognize that all of our kids are being impacted by the pandemic, some at varying levels of intensity or severity. So as we return, we are working directly with our PBIS coaches and our student services staff on proactive teaching and learning opportunities and community building activities that schools can use virtually, but also when we return from this pause in person. So really centering relationships, centering community, centering fun and belonging. Beyond that, we then have to think about students who've experienced things that are more intensive, more disruptive, more challenging throughout the pandemic, and really have to be thoughtful about what our plan is to support those individuals. My team at Central Office is ready to support schools from both a systems perspective of how do we make sure that we are connecting with and addressing all of the students who are struggling and need additional supports, be it mental health, social, emotional, or otherwise. And we have to be thinking about what students require individual planning and individual support. So our intensive support team is ready and willing to jump in and support individual students and situations as we navigate the complexities. As a reminder, we also have thoughtful and planful mental health interventions in our school that have been continuing throughout the pandemic, whether virtual or face-to-face. Dr. Getchow, what else would you like to add to that? Based on your experience and professional role as our mental health coordinator?
Yeah, Leah, I think you really caught a lot of my talking points. I think that, we have really highly skilled student service teams in our schools. And so we really want to just pave the way for them to be able to do their job. And then, Ali, you brought up a really great point about a lot of identification is based on relationship. So, there's universal teaching that we do, but then how do we let students, parents, teachers know what to do when they're feeling like what we're doing universally is not enough? And so giving our student service teams the time and the space the best we can, given the staffing shortages, to meet together and use their systems of support where they're, really advertising what, the look-fors are that someone needs something more. And then what's that predictable system within a school to make sure that a team is like looking at that information and making those really important connections to something more, whether it be a group in school, referral out school, increased communication with parents. We know that those referrals come in from lots of different places. So the more that we build those relationships with our students, with our families, the more we get that data, and then we can kind of hop in and put them into those systems that are in place with those other interventions and the connections with the community. So kind of multi-tiered approach, and we've got really great people in place to do it. It's really, and I mentioned this at the school board meeting New Year's Eve day, that, just like any other system in our school, we're feeling a little short-staffed and stretched thin. So whatever we can do to allow those folks on the ground to do their great work, the better that all is going to go. So.
Can I ask one follow-up question for both of you, which is, are we providing ongoing grief counseling for students who have lost members of their family to COVID-19, or for our faculty who have lost members of their family to COVID-19?
Actually, I'm meeting tomorrow with a Grace. We've worked with them historically, and they've stepped in to do groups through our Face Kids contract that we have. I don't know whether any of those are running right now, but they're certainly available to all of our students. And they've done a lot of individual supports historically. So I would not say that it's been like a new thread, but it's embedded in work that we've done historically and is certainly available.
Thank you so much. Board Member Morelli and then Board Member Vandermeulen.
Thank you so much, President Muldrow. Wanted to echo some of the voices from some of my colleagues regarding the gratitude to everyone that came and spoke tonight, all the emails, folks reaching out on social media. I think that is what made me really proud to live in Madison is how engaged our community have been, in particular around schools. Thank you so much, President Muldrow, for having us in this special meeting. And thank you, Dr. DeMurray and Dr. DeWald for your time as you're fielding our questions and listening to what's happening in our community. My question is segueing to the last couple of questions that both our president and our colleague Pearson shared around where we are in regards to this new variant. And at late December, we started seeing the surge, in cases. And today, I know I was in a meeting with a senior staff at UW Hospital, sharing that all beds are full at the hospital. And we're also seeing an increase of cases with children as well. And thinking that this variant is, although mild symptoms, it's potentially more viral. I don't know how to speak that in medical terms, more viral than other variants. And also having the data that we have around the number of staff and the shortages of staff, both here locally, but across the country. It is very possible that if there was a time where transmission was going to happen in school, this is the variant that would make this happen. What percentage, so if we do start experiencing transmission in schools, what percentages or thresholds you would like us to consider as we're monitoring this next semester, and and with the desire, and I share the sentiments that we do want to have the schools open this next Monday. What would you like us to consider as far as metrics or thresholds or percentages to keep the schools open?
Yeah, maybe I could just start here. I think that the things that are going to keep the schools open are having adequate staff to teach the children, having adequate staff to drive them to, make sure that their buses pick them up on time, make sure that there are food preparations. Those are the things that are going to mandate children being in school. If we see an increase in cases, we're going to ask the question, why? We'll double mask the kids. We'll increase the distance. We'll figure that out. Transmission in school is not going to be the limiting factor. It's going to be other factors.
Yeah.
If I could just add on just about the comment about the hospitalization, although overall numbers of cases are up, the numbers of hospitalized infections in children are not. We're at about the same level we were a month ago, 2 months ago. So that's reassuring, I think, from my standpoint. We're not seeing an increase in severe disease, despite an increase in cases, definitely an increase in cases. I think everybody is, fairly aware of that, and an increase in cases in children. And as to the secondary cases, it is something we track. And like Ellen said, I don't think there's really a threshold that would obviate school attendance. The limiting factor are other than, infections in the children themselves.
Yeah, I think my question was specifically around if we start seeing transmission happening in the schools, right? If we start seeing cases of either students or staff contracting COVID between staff to staff or student to staff or student to student, what are some of the thresholds that we should be looking at to caution us for an additional mitigation strategy?
Well, it will be really the things that I alluded to before. We're looking at primary cases and secondary cases. If we see them bump up, we're going to ask the question. We're going to see what we've changed. We will make a change in what we're doing. And whether, again, one of the things we know, for example, is that when the children eat together, that's a high risk. That's a high risk activity. And each school may be doing something different in terms of how they're arranging the lunch hour. So if in a particular school we see that there are more cases, we'll ask, are we doing the right thing in the cafeteria? Are we doing the right thing in the gym? Are we doing the right thing with masking? Are we really enforcing it? It really shouldn't be an increase in cases that leads to any school closure. Of course, we need our teachers to remain healthy. If the teachers, if we don't have enough teachers, we won't be able to teach the children. And so their health is paramount as well. But we should be, because of our careful tracking, we should be able to have early detection and then make an appropriate response.
Thank you so much. And thank you for elevating the caution around lunches and children and staff being exposed during that time. Thank you again, both Dr. DeMora and Dr. Wald, for your time.
Board Member Vanderpool?
Yes, actually following on what my colleague Ananda had said, on lunches, how would you suggest that we update the lunches to reduce transmission? Are there any specific things that we should absolutely avoid?
I think,
go
ahead, Greg.
I was just going to say, it's hard to get granular on this from a medical advisor position. This is something that I think is building the building, right? Because there are a number of factors where lunch can be taken. Is there a gymnasium? Is there, how big are the classrooms? Timing is really important. Do all kids need to have lunch at the same time? Those are all different types of considerations that are really building to building dependent. And certainly something that the health office and ourselves can work with individual buildings on.
That would be really helpful.
All right. I want to thank you all for your questions for our medical advisors, and I want to thank our medical experts for joining us and for speaking to adolescent mental health and a series of indicators and factors in terms of mitigating the risk of COVID. I'm going to turn it over to Dr. Jenkins, and we'll move into the rest of the presentation. Dr. Jenkins, you're on mute.
Once again, thanks to our medical advisors, and I tell everyone, I believe we have truly the best medical advisors in the world, and I truly mean in the world. You heard some of the credentials of the two who are here tonight, but we also have Dr. Henderson, who is also well-known in her area, and Dr. Friedrich, and they both bring great information to our Tuesdays meetings that we have, and we're a part of that, as you heard, the ABC Collaborative. So we're getting real-time, up-to-date information as we're trying to make decisions. Some of the things that, when we talked about the mental health piece of it that we were speaking to and thinking about how we addressing our students in school now, and even when we come back, we are taking out time to look at how can we manage some of our most vulnerable students in terms of addressing some of their issues that they may have, and how do we go about doing it. Right now, I'm so proud of our staff, the way that they're doing the home visits and getting ahead of the curve with the students. Once we know that we have issues, go and meet with the whole family, not just meeting with the student at school in our traditional way, having them go and see a counselor or psychologist, but talking to the whole family. And sometimes we're finding in some of our homes that it's issues even outside of school that we can help the families work through. And I appreciate the community partners stepping up and trying to assist us with that. Individuals like Anthony Cooper, Sabrina Madison they've been wonderful. And I've been in conversation with Jackie Hunt. We've got to look at different ways of getting people in our community involved in the schools in ways that can change this dynamic. We've done it individual schools, but we need to think about it from a whole systematic way of how we respond to what we consider to be some of our most vulnerable students and families. It's not just a student, by the way. Let me correct that and say the family, because often this is a family issues and school issues are community issues. So I just want to make sure we do lift that in this plan. And I will want to come back to where we are. We've heard a lot about virtual learning. We have a principal with us here tonight to talk about the impact of virtual learning. Ms. Stanford, do you have Mr. Love here at this point, and Ms. Lawler?
Yes, both.
Okay.
Both Mr. Love and Ms. Lawler are here.
Okay. Out of respect for their time, because we know they have to get back to school, I would like to have the principals go before the instructional continuity plan and have Mr. Love and Ms. Lawler talk about at the building level how they're impacted with this as well. So, Mr. Love, at this time.
Hey, good evening, everyone. And thank you for the opportunity to be here. First, I would like to start by acknowledging that, yes, we are still amidst a very real global pandemic. And I want to extend my appreciation to my colleagues at the building levels, senior leadership, the board, and the superintendent, as you have and continue to work in the best interest of our students, staff, and community. I wanted to take a moment today to share insights around what I have learned or heard and witnessed, provided witness around the thoughtfulness of the Madison virtual option at the elementary level. And I'll begin by noting that 87% of my scholars who are currently enrolled in the Madison virtual option identify as students of color. And while I have not spoken to every single family about their reasons for choosing this option, of those who I have spoken to or connected with, they have expressed extremely positive sentiments about this option. What has become abundantly clear in these communications, whether in writing or over the phone or in person, is that they see the Madison virtual option as a promising means to keeping their children safe and healthy, while also still being able to engage both academically and socially. Some families have expressed the ease of communicating with their children's teachers in ways that have not been always available before. being aware of the learning that is happening in a very nuanced way, understanding what their students are learning, seeing it firsthand, and being able to assist their students with the learning as they're also being able to hear and see what's happening in the virtual classroom. And then also flexibility are some of the most positive attributes that have been mentioned related to the Madison virtual option. These positive sentiments are most certainly second to the physical health of their students, however. While nothing about education is easy, especially in our current state, I do think that we have the opportunity to reflect on what we've gotten right as it pertains to the Madison virtual option and consider how we continue to do the work of teaching and learning while keeping the health of our students, staff, and community ever at the forefront. And thank you for your time and the opportunity to speak with you all today.
Yep, we're just bringing in the principal's voice as we've gone around to do our check-in. Ms. Lawler meets with us actually on the cabinet team as we're going through our conversations and talking about the impact of decisions on our schools and our children and our staff. So Ms. Lawler's here as well. Then you just want to talk about, share your thoughts. I'll put it like that.
Yeah, thank you. Good evening, everyone, and thank you for this opportunity to speak with you all. Having the opportunity to have these last 3 days with our staff is what felt appreciated by our staff. It allowed our staff to come together and check in on one another, given the decision to shift to virtual learning. Even a short shift in virtual learning requires a lot of dedication and thoughtfulness on the part of our educators to ensure that they continue to provide a top-notch education for our scholars. It also provided our staff a time to really be thoughtful about how we are attending to scholars' social emotional needs as we welcome them back from break, and also as we continue to navigate a pandemic, and that's been mentioned many times tonight. And we've also had an opportunity to connect with families and make sure that families have what they need, whether it's devices, supplies, or food, given the uptick in cases in our community, and again, the shift to virtual learning. So we've been doing a lot of connecting with families, and we've really had an opportunity to double down on and review our mitigation strategies specific to COVID-19. So as a staff, we're really feeling that we are now more ready than ever to welcome our scholars back, hopefully in person very soon.
Yep, and then last, before Dr. Pryor, Dr. Hicks, all of our school chiefs have been going out, just checking in on staff, and Dr. Hicks, with her experience with this, all this plays together with the social emotional and the health piece, but the logistical piece from a school side of it. Dr. Hicks, if you could talk about that in your conversations.
Good evening, everyone. So from a school side and working with principals and going into schools and communicating with them around this process and what is going on, I have found, and we all know, that we have a very dedicated and committed staff, highly skilled and qualified group of colleagues who are committed to ensure that they are doing the best that they can to serve scholars and families. While the shift again has created a little bit of anxiety around thinking about what this means, staff have shown up in ways to say, hey, we got this. We know how to do this. We have had some experience with this, and we're going to do this and do this well and do it better. One of the things that we need to continue to think about as we think about this short pause, and remember the word is short, is so that we can continue to stay back and stay in school. Right now we have 35 out of 52 schools who on the average of this week, and if it continues into next week,
6 absences a day. And that's a lot. And they're out for one reason or another. Some is for illnesses, some are for childcare or for whatever the reason. But that's an average of 6 absences of days to an already stretched system. We have a responsibility of care for everyone, especially as Dr. Wald said, our staff, right? Because if our staff are not available mentally, emotionally, or even physically to be able to do the job that they're called upon to do, then is that not also a traumatization for our young people? We want to be able to come back, do it well, and stay strong, and not put anyone's health at risk or safety. As we, as chiefs, have been meeting with principals and going into buildings and seeing staff, there is a level of peace and a level of calm in terms of the work. One of the things that we have done while we've come back too is we don't want to stretch the capacity more than what the system can sustain. And when I say stretch, just like the nurses and in the healthcare field, people are in those spaces working over and over and over and again, and what they're able to give is being depleted. And again, when we're working with kids every day, we're having teachers, we're having psychologists, we're having social workers fill those gaps in order to support young people. And we want to make sure that we are able to do the best that we can with what we have. And so they're excited, they're thankful, and they are strong in knowing that they can get this job done. I just want us to pause and remember that we have a responsibility of care for everyone and not just for some. And if our staff aren't taken care of and are available, then as the health officials have stated, then we can't do the job. So we just need to be mindful of that, because it can have a long impact as well. So, and I'm sure that when HR comes up, she will share some of that data as well.
Great. Thank you so much, Dr. Hicks and Ms. Lawler and also Mr. Love. And now we're going to continue with the continuity plan by Dr. Pryor and the rest of the team. And then we'll be more than happy to answer any questions as we're looking to move forward in the very short future with our in-person learning.
Thank you so much, Dr. Jenkins. And I would like to say good evening to everyone. And thank you so much for this opportunity for the team to come before you tonight to just share with you a brief update in regards to the work that has been taking place during this pause. However, before I jump into that, I have to take this opportunity to just really send out a heartfelt thank you to all of our teachers, our building level leaders, our staff members in the schools, and all of our central office staff. The level of commitment and dedication that we have seen, not only this week, throughout this year, and the commitment to students and families, it is unparalleled to what I've seen in my 30+ year career. I wish sometime, and I say this wholeheartedly, that I wish we had a reality show where you could see behind the scenes the dedication, how we work late at night to ensure that we're providing the best for our students and our families. And so I just wanted to just publicly thank you for that, because I know, we can't say that enough, and no words that I would speak tonight would do just in expressing our level of appreciation for what you've done. And so as I set this up for the team tonight, I have to talk about this. When we think about this pause, it's really a 5-day pause. I call it the 3-2 pause. 3 days for school preparation and 2 days for virtual learning. To be very transparent, this was a collaboration between the principals and central office staff and Dr. Jenkins himself, and trying to decide what is the correct calibration in regards to how much time you need in order to get ready for the transition into virtual learning. Originally, we said 2, and finally landed on 3. And from the feedback that we received from principals and schools, 3 was the right number. It provided them ample opportunity to get ready for the pause. More importantly, what we have discovered during this whole process is the fact that this was twofold. We're not only getting ready for the virtual experience, which starts tomorrow and Friday for our students, but this has better prepared us for our in-person return. And, you know, our whole focus about an in-person return is sustainability. You know, we have been very successful as a district. You know, all through this year, we've been able to keep our students in schools, in buildings. We have not had a major outbreak or anything, you know, and it was because of all of our mitigating strategies. And, you know, we have done well, and we want to keep that up, even in a time where we're experiencing an uptick in this virus. And, you know, why was it necessary for a 3-day prep? You know, as I reflect on it, I would have to say it was for 3 reasons. It gave the schools and gave all of us an opportunity to refresh, review, and to reinforce. So when you think about it, refresh, we had to refresh on our practices. We have, a ton of new staff, and we have substitutes who are in these buildings who have not gone through this before. And so it gave us an opportunity to refresh. When we talk about review, it gave us an opportunity to review protocols. What are our protocols in times of such? What are our protocols when we're in person and we have students or families who have to be quarantined for an extended period of time? We had a chance to go back and revisit those protocols and to reinforce the mitigation strategies that has worked so successfully for us up until this point. And so it gave us an opportunity to pivot and pause to do all of that. Not only that, it gave us an opportunity to go back and really revisit our instructional continuity plan, as you see here on the screen. And we'll talk more about that in a few minutes. But this is not anything new for us. We've had the instructional continuity plan for a while. We've implemented it before. And then after that point of implementing it, we had a chance to go back, to revisit it, and to improve upon what we have experienced from rolling it out the first time. And so this is the second time for us rolling the instructional continuity plan out. And this is a guide in regards to how we deliver instruction, not only during a virtual instructional moment, but also in person. So it was a great time for us to be able to pause and reflect on that. When I say it's not new, our students and our staff are very familiar with this. They use it every day. And the instructional continuity plan, the guidance from that lives on 2 platforms, our Seesaw platform for our elementary schools and our Google Classroom for our high schools. So students, no matter what platform we're in person or in virtual, they know how to access the supplies and the learning materials, resources, et cetera, for teaching and learning. It also allowed us an opportunity to reflect on what is the appropriate amount of screen time. You know, we learned from the past that extended amounts of screen time is not good. It's not healthy for students, nor does it keep students engaged. And so we had an opportunity to work with schools to emphasize what is the protocol, what is the practice, and what does it look like to ensure that we have a healthy balance between asynchronous and synchronous time during that instructional period. You heard earlier tonight, a parent mentioned that student left their devices at school. We've had a protocol all year that students take their devices home every year. I have an 8-year-old, and from time to time, she leaves her device at school. And so this pause also allowed us an opportunity for students to go and retrieve their devices so that they'll be ready for the virtual learning experience come tomorrow. Last but not least, 2 things I should say. MSCR, I just want to say thank you, Janet Dyer, for your leadership and your team. You all always answer the bell. You're right there front and center, looking for ways to accommodate our families. And we realize that childcare is an utmost important factor in this pause that we have. And so we have worked diligently with that team to ensure that we have 5 regional sites ready to go to support families in regards to childcare. And last but not least, social, emotional well-being of our students, staff, and our families is our utmost focus. I know as we talk about this pause, realize what family members and students and teachers and staff members are going through. It's almost 2 years to this date. The same time almost we heard about a pause that we thought was going to be short, and it turned out to be extended. Well, I'm excited to say this today that we are better prepared than we've ever been. We know more about this. We have the mitigating strategies. We've been well advised by healthcare professionals that we are confident. We're confident that, with this pause that we just had and the time that we had to plan, when we go back, we're confident that if we continue to do what we've done, we'll be able to sustain in-person learning for everyone. And so I know that I've said enough, but I have the people who are really doing the work, who work closely with the principals, are there with them all day. And I just want to thank them. And that is the curriculum and instruction staff and our chiefs of schools. And I would have them come forward now just to say a few words about some of the work that they have been doing. Thank you.
So, good evening, Dr. Pryor. I will kick us off. So many great points have been lifted this evening. To echo the sentiments of Dr. Jenkins, to center the social and emotional well-being of our staff while balancing the safety of our scholars, as President Muldrow mentioned. As a school community, it was our goal to not only work, but to continuously work cross-functionally at central office to ensure that the schools had coherent guidance and support structures to plan a path forward as we look and how do we navigate these next couple of weeks down to the next couple of years. One thing I want to echo, Dr. Pryor, you said it very eloquently. I want to also publicly thank the principals for their tireless work over the break, as well as the day-to-day meetings, even today, to plan for this pause and beyond, from principal meetings, think tanks, developing Q&As for what does school look like, feel like, and sound like when we go back in person, as well as attending drop-in office hours and co-creating this plan. One thing I like to say, it did give us a longer runway to ensure that we took those lessons learned to make sure that we had some very well thought out plans to ensure that we were very intentional. I think Ms. Lawler lifted it very well. While doing our school visits, the anxiety level of our staff has decreased. And I think that came as those lessons learned. And so we just thank you for this opportunity to be here. Thank you for the opportunity to lead. And Dr. Pryor, I will pass it back over to you.
Thank you, Mr. Harvey. Next, we will have Ms. Sanford come forth and just bring some information and share some of the work that she's been doing with her schools.
Good evening. I am going to just give some additional information about Madison Virtual Elementary, which Principal Love spoke about earlier. One of the phenomenal things about Madison Virtual Elementary, besides the tremendous work that the virtual teachers are doing, is that we were able to use what we have learned from Madison Virtual to be able to assist with the planning that we did this week for the pivot. We started off because there was a request by parents to have elementary students be virtual. They wanted an option for their students to be virtual. And we provided that with Madison Virtual Elementary. We have had our first semester. We will start our second semester at the end of January. And I want to be able to give you some data for the students that we currently have enrolled for the second semester. We have a little less than 450 students that are enrolled. 78% of those students are students of color, with the majority of the students being African-American students. 66% of the students are low income, 24% are ELL, and 17% are special ed. Since the Madison Virtual Elementary app closed right before break, we have had a tremendous uptick in the number of parents that are now requesting for the app to be reopened so that their students can join Madison Virtual for second semester. What we're currently having to do, because we are at capacity right now, is to create a wait list for those students, because we know that there is a need for parents who still want their student to be part of virtual, as they're not in a place right now to want to have their students be in person. Much of what Principal Love spoke on with learning from parents, the reason for selecting virtual, we are hearing that same narrative as well. And so again, just wanting to provide you with that information with the current numbers, and again, seeing the increase. And also I want to chime in on the tremendous work of the principals and the planning as well as staff and our virtual teachers. Thank you.
Carletta. Next, we have Ms. Kaylee Jackson coming from Curriculum and Instruction Department. She's going to share some information, and I think it's exciting information as how we're supporting our young scholars in regards to the screen time.
Yes, thank you, Dr. Pryor, and thank you all for this opportunity to share with you some of the work that the schools have been doing in collaboration with central office. So as we had said before, we were really able to take this entire year, but also these last 3 days to fine tune our plan and our instructional continuity plan, and really listen to our lessons learned. So this instructional continuity plan really took into account the feedback that we received from parents, from community students and staff around how virtual learning has occurred in the past. And one of the things that we heard time and time again, and we knew to be true, was that we didn't want our students, especially our youngest students, spending too much screen time, having too much of their day in screen time. So not only were we able to work collaboratively with our schools to adjust the lesson plans and the screen time, but we also met with them and asked them what it was. We met with our teachers and said, what is it that you need? What is it when you're in the classroom that would be super supportive to be able to reduce the amount of times that our youngest students are in front of the screen? And they said, listen, we actually would like more access to culturally relevant and decodable texts. So one of the things that we're doing right now is supporting our schools by building classroom libraries for every single one of our K-5 classrooms with just that, with high engaging, culturally relevant, decodable texts in both Spanish and English. So that will be something that we are really excited about to put in the hands of our youngest learners. Another thing that we know is true is that we still have students who are disengaged, and we still have students who are struggling with reliable internet access. So the other thing that this pause really allowed us to do was to work again alongside our schools and with central office staff to be able to create standards and grade level aligned resources in English, Spanish, and Hmong for reading and math for all grade levels K through 12. So that is a resource that will be available to our families tomorrow for families that are struggling with reliable internet access.
So much, Kaylee. And next we have Mr. Nelson Renner. He's going to bring some information in regards to high schools and athletics.
All right, good evening, everyone. And thank you again, Dr. Pryor, for this time. Thank you, Dr. Jenkins, and thanks to the board. And I would just like to say that we were very, very intentional this week when we had meetings with our principals to meet with them during this pause. We were intentional about making sure that we checked on them, their social well-being, and also encouraging them to check with their staff and their social and emotional needs as well. This is key for make sure that our teachers were very prepared in case of any potential future shifts we may have as well. And ultimately, our leaders and our teachers are working together to provide safe and supportive learning opportunities for our scholars. I have to reflect that throughout the first semester, while visiting schools, we've learned one thing is that our children and our staff are very talented and they're very resilient. And so we know we're going to continue to move forward with incorporating additional opportunities. Some of those opportunities are going to be social and emotional learning opportunities through contracted services for our scholars and through our high schools. And I'm just excited about how we're meeting the challenge overall as a team, district office personnel, school leaders, teachers, how we're meeting the challenge and leaning forward together with a balanced perspective to meet the needs of our scholars, staff, and our leaders. Also, moving to a different topic of co-curricular. Again, I just want to say publicly thanks to Dr. DeMary for his guidance and input on our co-curriculars. But we are very, very aware of how important co-curricular events are for our scholars and how it creates a positive relationship with our staff, and how the participation in these events during this time has positively impacted our social well-being of our scholars. You know, with the increased number of positive COVID-19 cases statewide, nationwide, this has impacted us here at MMSD as well with some of our athletic events. And we've been following and implementing those mitigation strategies and following the guidance and making sure that we focus on safety. And at this time, what I would like to do is just to turn it over just for a brief moment to Jeremy Slitz, our district athletic director, to provide some additional information on how we're moving forward with co-curriculars in a safe and positive manner. Mr. Slitz.
Thank you, Mr. Under, and thanks for everybody on the meeting. And, you know, as we talked about this extended pause, we've been participating in our co-curriculars, whether those be athletics or our other drama or music events throughout that winter break. And we did notice and were able to model some of the needs that we have with the Omicron variant and some of the increased case numbers. We've been consistent through our winter guidance and really focusing on eliminating some of the things that we've seen have led to secondary infections, including similar to our school closures previously. We enacted when we have 3 or more positive tests active within a program. We pause those activities to kind of allow them to run the course as we've seen some of those secondary infections. But at this time, it doesn't look like we'll lose any contests through the seasons. I really appreciate our coaches and student athletes and families for the increased understanding of the fidelity needed for our mitigation efforts and for the privilege of continuing on with those co-curriculars. There may be things, responsibilities beyond maybe just the general mitigation efforts needed to make sure we can continue to do those safely. And that's the plan.
All right, thank you, Mr. Slitz. And again, a public thank you to all of our leaders and teachers as we move forward. Thank you, Dr. Pryor.
Okay, thank you, Mr. Render. And I would just say in closing to the board as well as to our community at large, I just would like to thank you all for working with us in collaboration with us. And I'll just ask that you please know that we're working diligently to ensure a safe return for our students. You know, and this team is not only preparing for tomorrow, which is virtual, we're planning for a safe and sustainable return. And we have to plan for every scenario because we don't know what tomorrow is going to bring. But just please know that we are trying to stay ahead of every scenario that exists out here. And we're going to do everything in our power to ensure a safe return for our scholars. Thank you. I'm not sure if we're going to take questions at this time or we're going to go to the next slide. Yes, okay. I think we have some questions here. Right, I'm not sure.
So I see Board Member Vandermillen's hand, and then I'm wondering if
I forgot to take it down, sorry.
Oh, okay.
I think we want to move through the additional portions of the presentation and have questions at the end at this point.
No problem, Madam Chair.
Thank you. Sorry. No worries. Board Member Pearson, I see your hand up. Do you want to ask a question before we move on?
No, I don't want to ask a question, but I kind of just want to do, well, it's not really a point of order. If possible, for the sake of like the time and everyone's time and board members and community, can we please keep the presentation really high level? Like I understand that, you know, we want to try to get as much information, but we still have multiple portions of the presentation in addition to questions and comments that will, I'm sure will be more lengthy. So if we can just make sure that we get through things pretty quick, but also at high level. Thank you.
Thank you so much for speaking to that, Board Member Pearson. I think that it's really important that we speak to this current moment and make sure folks have as much information as possible about what virtual school will look like, as well as how prepared we are to return to in-person learning. So I think getting to the kind of heart of why we're having this meeting would be tremendously helpful moving forward throughout this presentation. And with that said, I think we should return to the presentation.
Good evening. I want to kind of bring to your attention what's going on in staffing and HR. As we continue to review the staffing information in context with understanding the ongoing social and emotional toll COVID has had on our staff and students, we are attempting to ensure we can support staff and students with the goal of sustaining in-person instruction for the remainder of the school year. The report I'm about to give delves into the analysis of challenges MMSD is facing regarding substitute staffing. We anticipate this challenge will be exacerbated by additional absences during the weeks of January 3rd through the 7th and January 10th through the 14th of 2022. As we are receiving additional reports daily of our staff and their family members being impacted by COVID. So what I want to do first is I want to give a little historical data so we can know, so we can understand the context of the absences MMSD is currently experiencing, but we need to look at the past to understand how we are impacted presently, and we will be able to move forward and into the future from this data. So what I did was I took the past 5 years, so 2016 to 2020, and back then the fill rate was 80% or above. So for 2016 to 2017, 2018, we were at 90% or above. And then for 2019 and 2020, we were at 80 and above. So closer to between 82 and 85%. For 2021, we were at 70%. And then for 2022, currently we're at 54% fill rate. I want to say too, also during these 5 years that I'm talking about, we've had an average number of subs, about 650, but currently we only have 391 subs for the 21-22 school year, with 84 of those subs subbing in another district. So that's kind of the historical context. And I also want to say that too, like if we were to look at the monthly absences during those years, so if we were to say for November of 2018-19, we had 4,600 absences, but you also had a fill rate of 90%. And if you were to look at it for December 2020 to 2021, your fill rate was between 70%. And then for January 20 to 21, we had 3,131 absences, but your fill rate is like between 54 to 70%. So you can see there's a change in that. So I also want to now move into current. So we're looking at, and I talked about before, October, November, December of 2021. So for October, we had approximately 20 instructional days. And during that time, we had a need for 5,000 subs, with 2,500 of those going unfilled, for a unfilled percentage rate of 49%. For November, we had about 19 instructional days with the need for 4,900 subs. And our fill rate for that was 52%. For December, we had approximately 12 instructional days with, again, what I said was 3,000 subs, and we had a fill rate of about 56%, okay? Now, I just wanna say that the data that I'm about to give now is very fluid. We have reviewed multiple data sources to anticipate staffing needs for these next 2 weeks after winter break. And so I just want to say too that our absence management does not necessarily indicate why staff is out of the buildings, but it depicts who needs to have a substitute. I also want to say, here's a comparison. And so we are looking at the number of absences and seeking outside the box solutions to sustain and to keep a sense of continuity when trying to fill these positions. And I want to give a shout out to the chief's offices for constructing a central office staff deployment plan. So I really appreciate that. I also want to say too that from Monday until today, I actually helped potential hires come in and fill out paperwork, and they were actually very excited about doing that. 2 of them were subs. One was an occupational therapist, and they were very excited to start working for the district. With that being said, the chief's office constructed a central office staff deployment plan, and that plan went from October 4th until December 17th. So they had 121 central staff members who signed up. And of that, 81 were certified to teach, 22 were certified to be support staff, and then 14 helped out with clerical services. And so they did this for at least one day out of the week for a total of 52 days. Now, the information that I'm about to give you now, this is the information that is very fluid. So I talked about the week of January 3rd. In looking at the absences for those days. Now, mind you, Monday, Tuesday, Wednesday, there were no school days, and then the absences that I'm representing are for January 6th through the 7th. And so as of January 4th, 2022, we had 217 absences with 75 that will go unfilled, okay? And then looking at the week of January 10th, we have 547 absences currently with 193 that will go unfilled. So I just want to put that out there. And again, these numbers are fluid because it could change between now and tomorrow. Presently, as we navigate through these shortages of substitute teachers and staff overall, HR is focused on recruitment and retention as tools to cultivate a talent pool for the district. This includes online recruiting tools such as LinkedIn, Indeed, and QTI as recruitment outlets to reach out to potential candidates. We have held 3 career fairs with a target audience of teachers, student teachers, and support staff. At these fairs, the fairs that we've had so far, we've had 128 potential candidates who have participated either visiting, registering for online, on-site, or virtual interviews. We will also be holding another student teacher career fair in February for the students graduating in May. HR has either started or revised some of our processes to make sure that we can recruit and retain and make sure that our hiring process is moving along and that we're monitoring. So what we're doing is we're going out every day and monitoring who's all applying. We're sending them information. We also have outlets for us to talk to us if there's a glitch or if they have a question about how to apply, when to apply, or where their application is. We've created guides to help supervisors and candidates navigate the hiring process and what the next steps are. We're also creating a listing of career fairs that we're attending. And we also have a whole informational sheet that's very interactive that our potential candidates can connect with us. And also we are making connections with the people that the superintendent had contact with at the HBCUs. We've extended hours. We have HR hours for our supervisors and principals, and they also can talk with their analysts. So we've set aside specific office hours for the respective schools. We've automated some of our systems, like we will be automating our I-9s and the background checks to speed up our hiring process. And when we talk about retaining employees, we're looking at working to coordinate support for our staff. And some of that support includes increasing the pool of staff who are licensed, developing certification pathways, Grow Your Owns, ALSE. I think I said there were ALSE, which is across categorical teachers. Other supports include providing professional development for virtual instruction in all aspects of student learning through the creation and the use of instructional continuity plans. More specifically, we have virtual self-paced professional learning. We have additional supports which include mentor teams for new teachers. And we also have leadership development and digital learning coaching support. And then a final group of supports involves coordinating direct outreach activities to enhance the engagement of students. So student services and the chiefs of schools are currently vetting proposals by psychologists and artists and residents. So I will stop there, but it's ongoing. And I just want to give a shout out to the HR, specifically our substitute staff, as they work diligently to fill these positions. Thank you.
Other questions there on staffing, or we want to go to the next piece?
I'm going to ask folks to hold their questions for each portion of the presentation until we make it all the way through the presentation. Dr. Jenkins, do you know how much of the presentation we have left at this point?
You don't have much left right now. You have operations coming up right now, and then we don't have the legal portion of it. We just wanted to give you an update in terms of our preparedness with the transportation and food service right now.
So we'll hear from Cedric and then we'll have time for board questions.
Okay.
All right, thank you, Dr. Jenkins, to the board, to my fellow colleagues, to our community and friends. Thank you for this opportunity just to share a couple brief updates. In regards to transportation, our initial conversation with Metro as of noon today was that they are appropriately staffed and ready to resume all normal operations beginning Monday, January 10th, 2022. Additional mitigating factors include mandatory mask wearing and testing of all drivers prior to returning to in-person instruction. MMSD is partnering with Metro Bus by allowing drivers to use our testing sites for limited or as needed testing basis. I want to thank Metro for working with us. They did report that there were 7 drivers that were out with COVID. And so the pause has allowed us the opportunity and our vendors the opportunity to recover so that we can actually get our scholars to school. Badger Bus has reported no interruptions in their anticipated services. Staffing levels are appropriate and ready to resume all normal operations as of Monday. Noteworthy, Badger Bus, in conjunction with MMSD Learning and Performance Center, under leadership of Jorge, presented guidance and instructions on how to effectively support our students during this social emotional time, particularly while riding the bus. I want to thank Jorge and his team. This is part of our retention strategy to ensure that our drivers and our vendors and our partners are supportive of our kids during this time period. Lastly, Badger Bus remains flexible and supportive during this pause time period. This includes specialized education route planning, TEP student route planning, and finally supporting food service for deliveries as well as drop-offs. We will remain laser focused on our commitment to our most vulnerable students during this time period. Food service. A brief overview has been sent to Barbara for the board for a more high level understanding. But for now, just kind of a quick overview of food service. The logistics around planning, approval, distribution, and DPI regulations have been completed. We are excited that over 40 sites are being served as of today, and we've served over 1,100 bundled meal packs for needy families. Despite frigid temperatures in the midst of a pandemic, our essential workers should be commended for their call to action. As you know, this was a 3-day turnaround, and our team worked tirelessly over this time period to get this done. I want to thank Food Service Director Nichelle Smith and her team for their efforts. Finally, food orders for next week and alternative menu plans are being finalized by tomorrow. Should we return to in-person learning next week or continue with a pause, the nutritional team is ready to pivot as needed. Keep in mind, ordering, supply chain issues, trucking, bad weather, all of that affects the food chain supply. So this pause is definitely necessary for us to ensure that we're ready and prepared to serve our kids when they come back. Lastly, buildings and grounds. Our buildings are safe, they're clean, they're ready for the return of our scholars. Kudos to our grounds team who has worked tirelessly over the break and during the break to ensure the removal of snow and ice. Parking lots have been cleared, our grounds have been pre-treated with salt, and so we're preparing for not only our staff, our community, but our kiddos to come back. And in regards to our PPE, Dr. Jenkins, we have increased our orders. Our par levels have increased. just to make sure that there's no shortages in our on-hand supply chain. Backup supplies of cleaning products, hand sanitizers, and masks are currently on hand at the FLOM location, and supplemental orders have been made. In reviewing our inventory, we have over 624,000 assorted masks on hand as of Monday's delivery. And so we're prepared for our scholars. And I want to thank the board for this opportunity just to share a couple of brief updates. Thank you.
So Chair Muldrow, we're going to, and the rest of the board members, we're going to talk now, give the board an opportunity, however you want to move the meeting, so we can answer any other questions that you didn't get a chance to ask during that time.
Thanks so much, Dr. Jenkins. I am interested in the board members' questions. I know we just heard a lot. I'm happy to go around to each board member and hear from all of you in terms of questions you may have. But I wanted to start us out with 3 questions. My first question is, after listening to all of those presentations, it was very hard for me to gauge how prepared we are to return to school on Monday, January 10th. And so can I get some clarification around what it looks like for us to be prepared to return, particularly from HR. So how are we screening staff around COVID, and how are we anticipating shortages and gaps in staffing looking to next week?
Okay.
I can't speak to the testing piece, but I can speak to the staffing piece of, we are, I would say the substitute office is working diligently to make sure that we can fill as many positions as possible. As I said earlier in my report, that we still are doing hiring. And so we are still bringing in new employees. I just want to say that we are working also with the chief's office as well, as far as filling positions. So I'm not sure, did I answer all of the question, but as far as the testing, are you talking about for COVID? Because we're not involved in that.
So I'm talking about our staff screening. And when staff screen to verify whether or not they have COVID or whether or not they have symptoms, as we're screening staff, what percentage of our staff will not be able to return to work in person as of next week, and how are we gathering information around that?
Let me have actually Nurse Carey speak to that for the screening that we're doing, and then also we'll have Dr. Hicks to talk about the number of staff potential absences, as she's been able to gather that from the principals as well.
So we are going to continue to use our daily email as a screener, where people will ask themselves the 3 questions. Do I have symptoms of COVID? Am I a close contact? Have I tested positive? If the answer is yes, the expectation is that they complete that screener. And after they complete that screener, they get an automated email back to them talking about what the next steps are and what they need to do in response to how they answer their questions, as well as our contact tracers and our nurses and our nursing assistants also help to call those staff to help them know where to access testing and what next steps based upon how they answered their results. So that process will continue. And as I said earlier, we have roughly this week so far about 175 people that are filling out that screener, and about 80% of them are staff. As you remember, we still have students that are participating in co-curriculars, so they are still they are required also to do the screening process.
Do we anticipate that we'll have a significant number of staff who are unable to be at work next week if we return to virtual learning based on the screener?
Based on the screener, Nurse Carey, could you respond to that? We did it both ways. We did something that we haven't done. We also had the chiefs go out and get it directly from the principals. And so Dr. Hicks will speak to that. But in terms of the screener, Nurse Carey, could you speak to that part of it?
Sure. So we report out to a group in the evening so that everyone is aware of the total number of positive tests we had, how many of those are staff, as well as how many people completed the screener and are positive on that. So it's kind of a separate process from when the process of when staff have to call in and report an absence. It's kind of, we just deal with the COVID piece of it. So that's what I'm able to speak to, and we do report out of that daily to a lead response team at Doyle.
Yes, and that's what I want you to give the COVID piece of it. And then Dr. Hicks will speak to the number of staff that have indicated that they're going to be out, which HR, that's the part, Ms. Carradine, that you were sharing with us earlier as well.
So as I stated earlier when I was speaking that for this week, there are 35 schools out of the 52 where there would be 6 staff out each day of this week. Principals are currently reporting information as they gain it from staff that they will be out. But if we continue along the rate that we did this week into next week, it would be a stretch to be able to do that with fidelity. And then also if we bring our central office staff on board and making sure that we're all out in schools, there's a possibility of it occurring, but yet again, the system is already stretched.
Right, and so to your question too, President Moultrie and all the board members, that is our intent to be ready. And even at the numbers where we are now, even though we know it's going to be a stretch, we've been stretching all year pretty much, but our intent, if all other things are well, with the staffing piece, just at that level, it'll be a stretch, but all central office next week will too continue to be out in supporting our return to school on January 10th.
If 36 of the schools have 6 people out for the week, that's 210 staff that would be missing next week. Do we have the ability to sub or have central office fill the spots of 210 staff?
No, central office not in isolation. And Ms. Carradine, you can also jump in and talk about this piece, but what we would have in our normal sub pool plus, central office just becomes a plus to what we are doing already, in which we, she shared, Ms. Carradine did earlier, we've been stretched all year and we know that, but we're just saying, can we sustain this rate? And then teachers are also covering for different classes. That was a part of when we approached you earlier in terms of the burnout from some of the staff having to cover so many classes. That's what begins to happen over time.
Board Member Gomes-Schmidt, I saw your hand, then Board Member Pearson, then Board Member Vandermeulen, then Board Member Carusi.
Yeah, thank you. I think dealing with this issue of staffing is really our critical piece here. And thank you, President Muldrow, for the questions that you're asking. I guess I just keep going back to the fact that it feels like we need a school by school analysis. So Dr. Hicks, I appreciate the knowing that 35 out of 52 schools, potentially have 6 staff out. One of the things that Dr. Esser talked about yesterday is that when you're looking at staffing levels in buildings, there's critical functions that you need to have. You have to have some administrative staff. You have to have your nursing staff. You have to make sure you have instructional staff for the classes or be able to arrange that in different ways. I guess I would really like to see that school by school analysis to tell us where we're at. Because to me, it feels like for going back to in-person instruction next week, this is going to have to be a school by school decision as to if we have adequate staff. We can't keep a whole district shut down because we don't have adequate staff at 10 schools, because we would have adequate staff at 40 schools. And so my question is how are we piecing this together to figure out where we have adequate staff, where we have enough subs, and where I know we keep saying we're stretched thin, and I completely acknowledge that. Every level of business and industry is stretched thin right now. Everybody is. And so I'm just really trying to understand. So as the board is trying to help with this decision process, like where we're at and how we are going to make this decision going forward.
And And so I would just say this, board member Gomez Schmidt, that we can give you that data. We didn't share it specifically out because it could identify specific schools, but we do have the numbers in each building that would be out this week. And again, they're adding as they know, as they get information for next week. So we don't have all of those numbers yet, but we do have that data for this week.
Okay, I think that's really important for us to understand the context and the level that we're dealing with at individual schools, because it might look different at elementary, middle, and high school too, as far as what strategies they can put in place to keep our schools open to in-person learning.
And so just to say like this out there, there were 13 elementary schools specifically that would have six staff out every day. So that's 13 elementary schools. There were 7 middle schools and 5 high schools.
Yep. And I get it. And I think we're going to be navigating a continual fluctuation for the next 2 to 3 weeks in staff out. But we have to get a handle on how we look at that from a staffing perspective and what we're able to cover. So again, that is my question is do we have the adequate staffing to cover and take care of that for next week?
Let me say, Board Member Gomez Smith, it's not that we will not have staffing to be able to open. That has not been the case. It's been, we've been stretched. And I want to bring that to everyone's attention again. Stretch. Our staff, I'm out. I'm in every school. They are like at their end wits right before break. When we approached you all the last time about the lack of subs, right? Staff are not getting planning time. And they're experiencing a pandemic. So this decision is not, in my recommendation, to be based solely just on staffing. We have a lot of factors. We said, and I'll say it here again, we clearly want to go back to school. Everyone knows, everything in the research says it's best that we're in schools. So I appreciate this opportunity to collaborate with the board because we all need to see what else in addition to, and I think some of the things said by HR about how we're looking at trying to not only just retain our staff, but we're trying to recruit other individuals out there in the community. If you want to come in and be a sub in our school, we would love to have you. If you're a teacher with a license out there, we would love to have you. So I just would rather, yes, this is a key point, staffing. We've been having to analyze this each week, every week. Every school is having to do. This is not really new. Staffing shortages were here before COVID. The impact of staffing shortages now is a whole lot different than before COVID because our people are mentally, I'm telling you, they're stretched. And I really don't know how any other way to say it to you, but I know what we're experiencing when I'm seeing staff members crying and I'm seeing students and staff relationships tense. We're trying to monitor this whole thing, but hear me clearly. Our goal is to try to go back to school unless something catastrophically happens between right now at 7:56 and at noon tomorrow when we send a letter out and we hear your feedback here tonight. Other than that, we're going to do everything we can to make sure that we're back in a safe way, looking at the science. Science is one piece of it, but we also have to look at what's going to make for a good environment for our students and our staff and our families. We feel the weight of this conversation in this question. We get it.
Thank you, Dr. Jenkins. So it's my understanding from what you just said is that we are going back to in-person on January 10th, next Monday.
We've said it from the beginning. That's our intent. That was aspirational. Unless something happens, catastrophically, that hasn't changed. And so, but we want to make sure we give the level of scrutiny, just as we're doing right now, as we've done every Tuesday. You've said in the metrics meetings with me, as we do with everything, we want to look at it because we want to make sure that we are taking safety to the highest level. And we have learned lessons of safety also means social-emotional when students are in isolation. Some students, because you also heard the data presented to you earlier, some students are thriving in online. Some parents have medically challenged children who know that in person is not best for them. So, we increased the number of online spots. You remember, because some parents were really challenged by it. So we're trying to balance all of this for everyone. And we can't look at one group and say we're done. No, this is about everybody. Our equity goal, our mission, every school is a thriving school. I think all of us here want our children back in school. My job, I'm talking about nobody else, responsibility is to make sure I bring you all the information, the best information. So when we make that decision, I can guarantee, and you can guarantee, every child makes it home safely as well. So that's what we are. Staffing is one piece, but that's an age-old piece. My 32 years, I don't remember the last time we really had enough subs. I don't.
Right. I just want to make sure that we are able to share with our community a clear and well articulated plan to get our students back to in-person learning, and details about metrics and thresholds about staffing, and when a classroom or school would need to move to a temporary virtual option. I think that's the anxiety that's being created and the uncertainty around this whole discussion. And I deeply appreciate all the work that has gone in this week to get us ready to go back on January 10th. But I really think we owe it to everyone to have a plan and to really analyze the staffing issue, if that is the key factor and leverage point that is driving the uncertainty.
I mean, the uncertainty is there because of the pandemic where we are. This stuff is fluid day to day. I mean, I've been dealing with it, like I say, for years, but it just, right now where you are, we've been doing this. This is not new to have a plan to have your school staff. We know what that takes. But what I'm saying, the other day, we had people do the screens and they popped up. One principal came and told me, another, just different people. And I can't identify people, but it just started happening. We hadn't planned for that, but we also had a backup plan to make sure that we can go. This pause has really helped us in terms of being even more ready for it. But it's many factors. I won't say that it's one, and I won't sit here now and tell you that it's one, but staffing is not new to schools. We had staffing shortages before COVID, and we've been able to pull it off. Sometimes I don't think that we're across the nation with the shortages. We're talking as colleagues, superintendent colleagues. We all know that we have busing shortages. We have SEA shortages, teacher shortages, administrative shortages, and we're still just making it happen. It is very complex. I wish I could give you a simple answer and tell you that I had a magic wand and it'll all be better tomorrow. I can't say that. It's aspirational. We want to be back in school. We're here tonight to hear your feedback. We want to go back, but we know the harms to, you call any superintendent in the country, opening and closing also contributes to the trauma in our community. And now this time we've even been able to talk to our community. We're ready, in my estimation, unless something else comes up. That's the only thing I can really tell you. I think really truly the data that Ms. Caroline just gave, that's more data than probably comes out a lot. That data is there. That's the data. But if you go back 16, did you hear the data? And you see the numbers dwindling. And we are very proud of the fact that our staff has stepped up and gotten vaccinated. Our principals, our union, all of us were together, the board, everybody. We have more things working in our, I think, in our favor. You heard Dr. Demary talk about it, Dr. Wall. We're part of the ABC Collaborative. We're getting information right now. People are following what we're doing in Madison Metropolitan School District right now. And I'm just telling you, we will be as prepared as you could be on January the 10th, unless something catastrophically happens. And let me tell you why I continue to say that. I'm not talking about what I heard. I'm talking about what I know and what I experienced. We said things when the COVID-19 started. We gave people dates that we were going to do things, and it changed, and we had to move the date back. Amongst the superintendents, we said that was the most frustrating thing. With the federal level, with the state level, and the local level, trying to get guidance, we get dates, and those things didn't stand. So it's kind of hard to say now to you concretely, I guarantee you we're going to be there January the 10th. I can only tell you aspirational, because that's where we are right now. But tomorrow, after we finish with this, and this is what we said, the conversation, we're going to hear from you. Nothing happens in between that. We're going to communicate just like we said out by noon tomorrow what our decision is. And then even at this point, I can tell you, I haven't seen anything to stop us from trying to get there on Monday. I haven't seen anything, but I want to be fair to everyone to say we're going to go all the way through the process.
Okay, I would still really appreciate if we could get the information on individual staffing by school individual staffing levels, and the articulated plan for instruction in person next week and going forward. Those metrics and those thresholds would be great.
Okay, we'll talk again about the thresholds.
Thank you.
Okay. Yes.
Thank you so much, Board Member Gomes-Schmidt. Board Member Vandermeulen, and then Board Member Castro.
Hi. Two things. One, we are not in control of the opening and closings of school. A very small micronic virus is. I don't like him. You don't like him. Guess what? We're stuck with him. His name is Omicron, and he's here for right now. I want to do whatever is best, whatever is possible, get us into school, but I will not sacrifice lives to do it. When you have 10,000 people dead from a virus that you call mild and 100,000 people hospitalized, that's not mild. Except the only people who are dying are communities that are mis or underrepresented. Yet currently we've become really popular nowadays. Everyone swears they're a person of color or a person with disabilities who knows how to speak, yet no one manages to ask those who've lived as a person of color, or in my case, a person, and Savian's case, as a person with a disability. And gosh darn it, we're getting, at least for me, I'm getting kind of sick of it. My life isn't expendable, neither is our students. This is an election soundbite, and if it is, you're on the wrong board. Plain and simple, we are here for every one of our students. Not one, not a few, but all of them, with a staff that is stretched to the max. I will do whatever it takes to provide it. If they need me to do lunch, I'll do lunch. If they need me to do recess duty, I'll do recess duty. But I won't have you condemn them.
I'm sorry, I think I skipped over Board Member Carusi. So Board Member Carusi, then Board Member Castro.
Thank you, President Muldrow. So I do have questions about staffing and our return to school. We are hearing loud and clear from staff that they are stretched way too thin. You're exactly right, Dr. Jenkins. Like, there's no question about it. We've been hearing this for a while. It's not something new that we've been hearing in the past 2 weeks. And the reasons that staff are giving for being stretched much too thin are far more nuanced than simply COVID. The reasons they're giving are that they feel like they don't have enough autonomy and respect in their jobs, that they're in a very top-down institution where they're told what to do. They're asking for COVID sick leave pay and have not really received a response in a long time. I hear that we're working on that, and that is good, but we need to make that a top priority. We're hearing from staff that they're being asked to spend too much time assessing children and not enough time just working with children on their social emotional needs and reaching out to their families and making sure nobody slips through the cracks. We're hearing all these things from staff, and in order to sustain our staff, we need to look at that whole picture of what our staff need. Staying virtual is not in the best interest of our students who are stretched too thin. It's not in the best interest of our parents and families who are stretched too thin. And if we don't have the staffing to open certain schools, we can't push our staff to the point where schools aren't safe and they're not able to teach anymore. That's just reality. But the fact that we don't have the staffing in place to reopen, to me, is indicative of a much longer term problem in terms of how we've been treating staff in this district, not for weeks, not for months, but for years. We need to look at that right now with all the seriousness that we're giving our staff and the state that they're in right now, and look at that over the long term. We need to what?
Chris, I'm really sorry. I want to apologize, but there's music playing over you speaking right now.
Oh, really? And my daughter's taking her piano lesson. I'm sorry. Is it better if I lean closer to the computer?
Okay. Yeah, I think
okay. So. I will lean forward and try to speak louder. We need to take more seriously what our staff are asking for to feel respected in their jobs and to feel supported in their jobs. And we need to like make that our top priority now and moving forward for the rest of the school year. And I piece of that. I actually think some of the other things that staff are asking for are what we really need to prioritize. And the big piece of that is giving them, you know, the planning time they need right now to be able to reach out to families, giving them the COVID sick leave that they're asking for, and giving them the ability to make decisions about how they help students recover the learning that they've lost and also meet their social and emotional needs at a time when we know and we've heard that students are suffering from anxiety, depression, eating disorders, a whole range of struggles. I sincerely hope we can come up with a reopening strategy for Monday that gets as many schools as possible open. I don't want to see us shut down the whole district because we can't staff some of our schools. At the same time, I also very much respect our principals who are just struggling to make sure that we can get things staffed and want to respect their needs and their sanity, and also make sure that we're listening to them. I would like to ask about subs. A couple of months ago, we voted to increase sub pay. I'm wondering where we're at in terms of implementing those increases in sub pay, and if that will also increase the pay of our long-term subs who we need right now and we need to retain very much. So I would like to hear more about where we're at with sub pay increases, both to attract subs and to retain subs in the district.
Okay, we'll have Ms. Carradine address that.
As I said before, we are still hiring subs. We do have applications coming in. They're not many, but we do have them coming in. If you're referring to the memo that was done back in November, that's by the end of the month. So each month they get paid for that, but you're always a month behind. But that is an incentive that we are using. And again, as I said, slowly but surely, we are getting more applicants, but not enough to kind of offset the positions that we have that go unfilled.
Are our subs getting paid more now? Like, have we started paying our subs that bonus? And is that going to all subs, including long-term subs?
Yes.
Okay, thank you. There's so many things I could talk about, but I don't want to take up a whole lot of time. I just want to reiterate, I really think for the sake of our community, for our kids, for looking at the whole system that MMSD is a part of, we really need to reopen schools. And in order to protect our staff, we need to listen to them. And, you know, knowing that the best thing we can do for kids is reopen schools, we need to look at all the other things that our staff are asking for in terms of maintaining their professionalism and their pay and their ability to take time off if they are affected by COVID. And we need to listen and we need to do those things in partnership with them and with MTI moving forward. So thank you.
Board Member Castro.
Thank you. Real quick, I had a clarifying question for Ms. Carradine on the 30 schools having 6 people out per day one of the weeks. Is that are those 30 schools the same schools, or is that any given 30 schools will have 6 people out per day? Does that question make sense?
So you were saying 30 schools that have 6 or more people, you said 6 or less people out?
Yeah, 6 or more. I think that's the figure you gave.
No, I give numbers of filled and unfilled, but if you're talking about, I know the question came up about schools that have 6 or less, it's 17 schools that have 6 or less. You know, positions that are asking for subs. Okay.
And those are the ones that were entering the system, but then the principals reported differently.
Correct.
This is fluid. That was from that day it was drawn out. And then Dr. Hicks gave the numbers.
Okay. Oh, I'm
as
sorry.
Last reported.
Dr. Hicks, what was that one figure that you were giving about at least 30 schools?
You're muted, Dr. Hicks. We saw you answering, but I didn't hear you.
Yeah, that's though it was 35 schools and it was the same schools. So
Okay.
it was 35 schools. And also just when we talk about we say we want to go school by school, we're going to do whatever decision based upon Dr. Jenkins and all of the science and all of that to make. But I just want us to think about when you talk about equity or inequity. And inequity is to close schools and open schools based upon that, especially when our most marginalized families and scholars have been vaccinated the least, and our title schools and our Black and brown and our children of color are in those schools, and those are also would be probably some of the schools that would be shut.
Right. Thank you. Yeah, and I just wanted to clarify if those were a static 35 schools, or if it was any given day, a number of 35 schools could have that number of folks out. And thank you for clarifying that. I think big picture wise, this pause was necessary, and certainly hope, in considering that we had a surge of a highly contagious variant sweep the country during Christmas and New Year's, where everyone was in close quarters, and likely almost everyone knows at least someone who was a close contact or had it themselves. And given our very high accelerating numbers, to have this pause to make sure that we could safely reopen on the 10th, I think it was necessary. And I think moving forward, Dr. Hicks, you did mention the inequity that likely would come in terms of closing schools on a school by school basis. I do have a question related to that, though. If going forward, we have to come to the decision that a classroom has to close, or a grade level has to close, or a school has to close, what does that communication look like? And what would that procedure look like to prevent, the loss of instructional minutes for students?
Yeah, let me just say, first of all, everyone, that we have a protocol for closing classrooms in schools. And I mentioned it earlier when I talked about how we moved forward with MSCR, and also what we've been doing in some of our schools right now. So Nurse Carey and Dr. Elser, if you want to talk about that process that we have in place now, which we will continue to look at as we move back to in-person.
Go ahead, Carrie, you beat me.
Sure. So for classroom closure, we look at the total number of students that are going to be out for a defined or specified period of time. And so what we typically do is we base it upon half or more of the students are out of the classroom, and then we would switch to a virtual instruction model at that point in time. That's what our classroom guidance has been up to this point.
And just to elaborate on that, when we first began the school year, the idea and the process of contact tracing and closing classrooms was an intense process that required a large group to come together, to huddle, and to look at a variety of circumstances, to calibrate on situations, and to offer guidance on next steps. We have since developed an excellent system that has really automatized, and our nurses and contact tracers are able to do that in a very fluid and undisruptive way. I would anticipate a similar type of structure could be applied when we think about school closures as a whole, whether it's related to COVID spread or simply staffing challenges.
And this is a conversation that we've been having, because we continue to mention lessons learned, and this is one that we know that could, while we're confident once we open, we could probably stay open longer because of some of the lessons learned. And this is just one of them that we have to continue to interrogate to make sure we can get to that place. But keep it in mind what Dr. Hicks said in terms of the equity issues, but we also have a realization of individuals, regardless of whatever, have a percentage of our students who have been vaccinated, others who haven't been vaccinated at this point. So it's other conversations that we probably need to have too, even at the board level as we're moving forward.
Thank you. And follow up, and should one of those things happen in the future, hopefully they don't, because we're taking this time to gather ourselves. From a CNI perspective, should a classroom or grade level or so forth have to go to virtual, will there be, those online learning materials accessible to the classroom teachers in terms of like their lesson plans being, their in-person lesson plans being able to be converted to online lesson plans?
Yes, great question, Savion. So the answer is yes. One of the lessons learned from last year was that we needed to be sure that our scope and sequences for in-person learning were able to easily be transferred over if we were going into virtual. So all of the guidance that comes out from CNI allows for that, which is also one of the reasons why we chose some of the platforms that we chose, right? Because we knew that they would be able to be used both in the virtual and in the physical world. One other thing that CNI is doing to support, because we've already had to close down classrooms, is we have a live website in which we are putting up choice boards as it relates to our specials, to science and social studies, that we're able to give our families access to in times when we do need to shut down a classroom. But to answer your question, Savion, yes, absolutely.
Yeah, and let me say, I really appreciate that part that you just shared to Ms. Jackson. If in case we have to close down a classroom, I want to say this to everybody. We want to open up on Monday. We want to stay open, right? But we realize where we are right now with the research, the science around the Omicron, we haven't even hit the projected peak. And we are talking right now so that we can be as prepared as possible, stay open as long as possible. But as Board Member Vandermeulen said too, we don't control the virus. We don't. And I don't want our community to have a false sense that because we're trying everything, we are not superheroes in education. We're educators. And if this virus chooses to come in massively, and we should know this from COVID when it first came the last time, we have to adhere to what the science is saying and what our limitations are around the mitigation strategies. One of the things that Dr. Friedrich said, who wasn't on the call tonight, but if staff, which are a part of the mitigation strategy, right, have an adequate staff. So I appreciate Board Member Gomez-Smith's question earlier in that staffing is a part of those mitigation strategies, but we have to continue to watch this, take our metrics meeting on Tuesday very seriously, and we have to work together to make sure that we can do this because we know everyone is impacted by this. So thank you, Ms. Jackson, for those comments. And one thing that we do know, we do not want to go, unless you just extremely concurrent teaching, that is like a bad word throughout the district with students and parents and staff. Okay.
Got it. Thank you. And yeah, I just this predicament that we're in right now has certainly exacerbated some of the long-term staff concerns that we've had for years, as Board Member Carusi alluded to.
Mm-hmm.
I know a few months ago we added more sick time for staff too, which I think was the right decision. We should definitely consider more paid sick time or whatever as well. And also talk about the burdens that our staff of color have to face during this time as well, and the deep cultural work we have to do in this district to attract more Black and brown staff to Madison too. So thank you. Those are my comments.
Board Member Pearson.
I'll try to be very brief. I just want to make a couple comments and then just a question. So my comment is about around community. I think overall, our schools, our board, our administration, our teachers, our children are one piece of the puzzle when it comes to our, making sure that our children are as safe as possible. Our teachers are also safe. I think overall, we got to realize that this is not just only a school issue, right? Like this is also a community thing. So we need the community to, I mean, I've said it in the last meeting, like we need grace for everyone, but for real, like we need the community to also be a part of it. And I think in the past couple of days, we've seen community members step up and help assist, not blaming, not pointing fingers or anything like that, but actually stepping up and trying to offer whatever help that they can. And so I just wanted to make that comment that this isn't just us, it's Madison as a whole. We're in this all together. And so let's continue trying to find the best way possible forward. I am in complete support of starting school on Monday, not just only as a board member, but also as a parent, and of 3 little ones in middle school and elementary, but also part of the community. We had some community members come in and talk about some of the communities that are most impacted by COVID, and it's real, right? And so I'm also part of that community, also live in that community. And so for me, I am in complete support for starting Monday. And so as much as we can figure out and make sure that we have a cohesive plan, and we are able to stay open as much as possible, let's try to get as where we need to go. Sorry, there's a lot of thoughts. And then just my last thought before I ask the question is that as things change, and we have to keep in mind that things will change, and I'm glad that the health experts said what they said earlier, that with the current guidelines that have just been put out, they're now looking at how it will manifest and how it would actually impact our schools. I think that we are in a good position, and but also keeping in mind that things do change. And as we've seen over the couple years, if it needs to go into virtual, then that's a whole nother conversation that we all should have as a community, that being a real possibility, and that we're just not only going to say, we can only do in person and that's it, or only do virtual and that's it, but understanding that this is something that we can't control, but we can control what our response is. Thank you, Dr. Hicks, for mentioning earlier about, not having the entire district closed, or not having some schools closed. If it's not a district-wide problem, that is an equity issue. And it was something actually I was going to say, but you said it before I did. So I just wanted to one up that, because I think it is important to keep that in mind, that when we're talking about some of our most vulnerable communities, we're talking about the folks that are most impacted right now, the folks who may not have access. There's a possibility from what we see that those schools might be the ones that will not open. And so I understand the reasoning in stating that, but I also understand that if we are truly what we're saying that we are, if we're trying to be, and I absolutely don't like the word anti-racist because I sometimes think it's whatever, but anyways, but if we're truly taking an equity stance for people of color, more specifically Black children, making sure that our teachers are well supported, then we cannot just only have some schools open and have other schools closed. And so I'm totally against that. And I think that as a district, we have to really, and as a board, really think about that and how we are going to set the tone for our work moving forward. So I just wanted to mention that. Now to my question. We know that central staff, I've heard that, Dr. Jenkins, you mentioned that central staff is supporting some of the schools and supporting the teachers. But I guess my question is just like, in which ways are they also subbing, or are they just floating around just to schools, supporting where they can? So that's basically my question around just like how central staff and the administration is supporting the sub pools.
I'll have them speak to that. Dr. Pryor, you want to go ahead and speak to that? And Dr. Hicks? Don't rush.
Yes, I'm sorry. Yes, Dr. Jenkins and Meyer. As Dr. Jenkins says, all hands on deck. And we have been functioning like this for a while. We have been subbing and we've been helping out as needed in schools. And the team and I, we met today and we elevated the concern and said that we're gonna also be elevated, if you will, coming Monday, because we realize that in order for us to keep these doors open, in order for us to keep students in schools, we have to be as creative as we can possibly be. And just to share with the larger community, the community at large, it's a huge challenge because there's also other work that needs to be done. And we're trying to juggle both, but that we realize that these are the times that we're in now. It is not something that is unique to Madison. It's happening all over the place. And so as Dr. Jenkins has given us the charge to really do everything that we can do to support schools so that we can continue to keep the doors open and students in seats. We have all made that commitment to do that. Now, I want to be honest with you. When we think about the sustainability of that, it's taking a toll on everyone. But as it was mentioned earlier, we have teachers in schools that are making those sacrifices too, with planning time where they're covering down. But that's where we are. It's a reality of the current state that this whole country is functioning under. And so that was a long answer to your question. But yes, resounding yes, we're in classrooms.
Thank you.
Board Member Morelli, and then I'm gonna move to Nama, and then I have a few remarks.
Yeah, thank you, President Muldrow. I wanted to lift up something that our colleague Nikki Vandermeulen and Maya Pearson just shared that really centered me on the humanity of this experience that we're having. We've been in this meeting for about 3.5 hours. We had about 600 folks joining us virtually and more. I've been hearing a lot of the Madison way of doing things. The ways of, well, let's keep my school open, or we need this data and this data and this data and this more plan and this plan and this plan. And as long as we have all of that, we're going to be okay. Or as long as we control every potential factor, we're going to be, we're going to be okay. And what I haven't or have seen less in this conversation today is around the compassion and the shared humanity of everyone in this call. I know many of you have not slept for a week or 10 days. And I've done many hours of work and reading and whatnot. And I know this morning I woke up with a flood of news from all over the country of folks experiencing the same as us. And we, for some reason, think that we are gonna, if only that data point, if only that plan, and then we're gonna be okay. And it just feels very condescending to just the human experience. What I would like to shift in just a little bit of what Board Member Pearson was sharing around what is our long-term strategy. We're going to be here for a while, whether it's COVID, whether it's another variant that we just announced today, whether it's another virus, what we are going to be dealing with some sort of crisis or mitigating some sort of crisis. So I wanted just to share a couple points. We have made our schools a point of reference for so many community services. And what we have learned, if nothing else, COVID tested us, is that aside from the fact that we can do it, that we've been doing it, it's not sustainable. We have become food pantries. We have laundry facilities. We have become mental health providers. We are become testing sites and community information source, and all sort of ways we've been serving this community. And we are stretching every adult in every building. I haven't heard folks talk about how the bilingual resources staff are doing double duty in every emergency communication that we send, which has not been just only one time or 1 week. It has been almost every week for the last 2 years. Our nurses, so many schools have only one nurse appointed, and some schools have, part-time nurses coming in and out. What is the long-term strategy for them? Our student services staff, we already knew before this COVID pandemic that we were well under-resourced, and now we have even greater need for our students and for our families. And so what is the long-term strategy for a much more comprehensive waiting for hiring is just not what, it's not sustainable. Figuring out how we're going to do partnerships with the community, as board member Pearson mentioned, it might be one way to do, which we have relied on a lot of them. What does it look like to have a comprehensive COVID paid leave bank where folks are not worried about, the timeline? I appreciate, Dr. Jenkins, you mentioned we've been hearing from our governor that we're going to be Wisconsin back 3 months in, and this is a year and a half later, and we're still here. So what does it look like to stop putting a date on some of the resources and the mitigation? The work on the mitigation strategies that we're doing. What does it that look like that we're just saying we're going to do this ongoing and supporting our staff? In regards to communication, what does it look like for a comprehensive FAQ for our schools and for our district, where when people have questions that we can say, like, here's the link to the question that you're asking. All those questions have been really important, but we should be able to provide those informations to our families and to our students. I've been thinking a lot about the monitoring of retention long-term. So what is the coaching support for supervisors and principals so they are part of the solution and the retention of our educators, central office staff, and our subs? What does it look like for a comprehensive volunteer pipeline or grow our own pipeline? Things that we have talked so much, but we haven't really necessarily seen a comprehensive strategy around that, and bringing our youth workers and our partners, UW, Edgewood, and Madison College students to support. I think that, Madison has done a disservice to our community when we have not been a good partner, or have said we can do this by ourselves. And we have said that many times, and we act like we can have everything figured out. And it's obvious that we can, and it's okay. I think one of the things that's been the hardest things that I've seen leaders navigate is to say, we don't know the long-term effect on anything that we're experiencing right now. And we don't know when it's going to be the peak of Omicron, and we don't know what's going to happen with this new variant, and we don't know what's going to be the new virus that we're going to be dealing with. And I think it's okay to say that we don't know and look at what is the long-term strategy. But instead of nitpicking at people and what they're not doing and what other thing that they should be doing that they're not looking at, is that, like, how are we showing up as a strategic partner and a supporter of the school district and our families and our students and our staff. I appreciate each and every one of you, because I know it's been a really strange turn of the year that usually is a place to inspire hope, to inspire well wishes. And I know it was a really hard starting of a new year, and we are far from having any kind of relief. So it's really painful to be in a 3.5-hour meeting where if you squeeze it out, there's the nuggets, the golden nuggets are, get missed with the run around. So I thank you. Thank you for all of you for showing up tonight. And thank you so much to our MMSD staff for continue to figure out what we're doing. And I'm full support of what the thinking of what is next for our schools. Thank you, President Muldrow.
Nama, I'm hoping that we can hear from you if you want to speak a little to the conversation we're having this evening. And thank you for joining us and listening so contently for so long.
Of course. Thank you for allowing me to be in this space. I really appreciate hearing from you guys and kind of getting the information that I can relay back to like classmates and students that are coming to me with questions. So I guess first, I just want to thank you all, thank you, superintendent. Thank you to the board members who are working hard to get us back in person, to the administration and all these presentations, as this has been an informational meeting for me, and getting to hear from all these perspectives. I think I have a better idea of what's happening in the upcoming week. As a student, I do also want to be back in person. I know a lot of other classmates want to be back in person. I'm a senior and I want to end the year off strongly, as this is our last year in our district. And I know a lot of other seniors feel the same way, but I also want the elementary schoolers and the middle schoolers to have the same experience that I did in this district. And, through this educational system and having the ups and downs and, having that experience. I want that for them. But I also want to do this safely, and I want to prioritize, mental health and getting underprivileged students, that accessibility that a lot of privileged students have. And I also want to make sure that our staff is getting the same resources, the same help that, we're trying to provide to our district, as our staff is kind of the backbone of our district and, providing us the education that, we're getting. So I do want to prioritize them and make sure that we're returning in a safe type of way. And as we've been talking about throughout this meeting. And I also want to thank you guys for the questions you've been asking about the staff shortage. As a student, I don't have that much of an idea of how this works, but hearing from you all, I know that this is, a concern, and getting this addressed is a top priority that we should have. And I also want to address that Board Morelli just said that this virus is just going to be reoccurring. Even after spring break, we just might see a new variant, and, there might be another surge, but we can't have these pauses or these, issues reoccurring that might be happening for the next year. So I think we do really need to focus on better mitigation efforts and, making sure that there's a safe place in schools, whether it be, staffing concerns, making sure that students are masked up, and making sure that they have the accessibility to get these masks that, are safe ones and are going to fight the new variants that are going to be reoccurring. So I think addressing these strategies and these mitigation efforts are going to be really important in the upcoming week, especially if we're returning back in person on Monday. I also want to address the transparency that the district is showing, especially to the students. I think it was last Thursday or Friday that we got the news that we were going to be back in person. And as a student, I was hearing this from like all different sources. I didn't receive a single email from the district that was telling me that I was going to be in virtual for the next 2 days and having this pause. And I think a lot of other students were having this confusion about, what was happening, hearing from different news outlets. So I guess I just wanted to say that a lot of students are asking for this transparency. We want to get the emails. We don't just want the parents to get the emails, because a lot of students don't have access to the parents 24/7. They can't, can't go into the next room and ask them to, hey, can I see this email? They're busy. Their different familial situations are happening and students across the district. So kind of making sure that we're receiving these emails and making sure that, we have a line of access straight to the district and, what's happening. So those are my 2 points. And then my one question I did have was, I've been hearing that a lot of strong support for in person. So hoping that we're in person. I guess one of the biggest concerns I have in a high school with a lot of students, and I think a lot of different schools are probably going to face this, is lunchtime. Since the beginning of the school year, I've been sitting on the floor at West and eating my lunch. And so I guess a lot of concerns that students are having is how can we make sure that lunch is a safe space for everyone, and making sure that, you know, we're reducing the spread of COVID in like an hour period that a lot of high schoolers have. And, you know, we can't go outside anymore. And a lot of students don't have access to, you know, get in their car and go home or walk home. And so I guess my biggest concern is there going to be space for students to sit in teachers' classrooms? You know, we don't want to overburden this teachers as well. You know, this is their space, their time to, you know, get ready for the second half of the school day. So we don't want to, you know, take up their time or, you know, their space to have their lunch, but we also want to eat somewhere safely and somewhere where, you know, we have the ability to like take off our mask comfortably, you know, having also that time to, you know, talk with friends and, you know, having that communication and that kind of connection that is what in-person school is about, you know, having that connection with friends and teachers. So I guess that's my question is, how is lunch going to work when we return back in person, and if we're returning back in person for the next few weeks?
Mr. Render, do you want to speak to that with the secondary? But actually it's throughout, but if you want to speak to it to the secondary, and then I could talk about all of it.
All right. And thank you, Nama, for lifting all of that information. And I just want to echo again that you are way beyond on your years when it comes to the intelligence. Thank you so much. You have so many gifts. I would just say that what we've been doing is having discussions with our high school leaders and also our middle school and elementary school leaders. And we provided them with a checklist. And this checklist was to go through some of the process as far as making sure that we have mitigation strategies in place, making sure that we have thoughts about how we're going to make sure that transitions are safe when we come back, making sure that lunch is safe when we come back as well. Also thinking, thinking specifically in regards to knowing that now that the weather has changed, that more of our students may not go outside for open lunch, which means more of our students will be inside. And so we have to think about making sure that there's safe spaces. And so our staff have been informed to make sure that they create those safe spaces for the children to eat lunch, continue to remind them about practicing social distancing, continue to remind them about making sure that they're following the mitigation strategies, using their masks, and also the staff members making sure that they monitor those students and remind them about how to be safe on a daily basis. And I guess what I can also do is pitch it over to Mr. Hodo if he has anything additional when it comes to specifically food service and during lunchtime. Thank you.
Yeah, thank you, Dr. Render. To your point, I think it's a case-by-case basis from the school's perspective. I think the key ingredient for us is once school bells are out, my team will be prepared based upon a daily basis. We typically will see a consistent count of kids who are eating. We have increased that based upon a lot of kids not necessarily leaving during this time period, particularly open campus. And so we have increased our par levels for food as well. Ultimately, it's going to boil down to production. It'll be a hit or miss basis, but once we get a really good gauge of how many students are there, rest assured we'll be prepared to feed. But ultimately, it's going to boil down to the high school bell schedule.
And a lot of, thank you both for responding to that. Part of what we've been doing during this pause is talking about every aspect of school from the beginning to the end and reinforcing mitigation strategies. And so you heard Mr. Render and also Mr. Hodo speak to that, but that was a great question, Nama, and a question that we all had that about going back and just wanting to reinforce our mitigation strategies. One of our doctors earlier mentioned that's one of those areas, right? Because when you're eating, you take off your mask, but it's just a simple reminder, keeping the space. And West is already a large high school, while high schools in general don't have large cafeterias, but that was an area of concern. So thanks for asking it.
Mama, thank you so much for the points you brought up, and thank you for speaking to both your own desire to be back at school, but also the necessariness of making sure we return to school safely. I think, I want to thank Dr. Render, and I want to thank Cedric Odom for everything that they've added to this conversation. One of my big concerns was that we were not going to have the bus drivers to get kids to school. So knowing that we're doing that testing and that we won't have, our elementary school students standing out in negative 13 degrees waiting for a bus that's not going to show up because we don't have enough drivers is really reassuring. And I think that's a key indicator in our ability to return to school. So thank you so much for doing that work and making sure that our community knows we are prepared to bus students to school on the 10th. And we are working in partnership with Badger Bus to make sure our drivers are tested and healthy and have that support. I want to say that I'm hearing from a lot of our board members that the priority really is getting kids back to school in person. And that, we're hearing also from our medical experts, whether it is our mental health experts, our adolescent mental health experts, whether it is the health experts we've been working with to navigate the pandemic long-term, that kids are safer in school. And so everything that we have heard tonight reinforces that getting back to school is our top priority. And now it's really about communicating with our community what makes us prepared to get back to school on Monday, January 10th, and what is the plan that we have that will allow for us to return to school safely and to staff our schools safely. And I think anything that we can do to assure our community that they can trust our decision-making process moving forward, and that they can know what to expect in terms of when we will return to virtual learning and when we will, return to in-person learning, and what the next 2 days are going to look like for their families versus what next week is going to look like. And so I think that is, what I hoped we would be able to do with this conversation. And I think, hearing from our medical experts, as well as hearing all the things our team has done to prepare, has been tremendously helpful. I'm gonna call on Board Member Gomez-Schmidt, and if we don't have any further comments, I will entertain a motion to adjourn. Board Member Gomez-Schmidt.
Thank you, President Muldrow. And this is sort of a conversation that went it was a while back, but I just wanted to circle back to what Board Member Pearson said about the disparities we might see in having to close different schools and the problem with that. One thing that I want to say is that if we take a look at permanent staffing issues, at subbing issues, and then the overlay of the problem of staff being out with COVID, and we look at how that impacts different schools, this is actually an opportunity for us to help figure out where we need to put more resources to help our students and help our schools and support those communities. And so again, the staffing decisions for next week are what's critical right now. And so understanding where we stand with this, I really hope we are leaving this meeting reassuring our community that we are going back to in-person instruction on January 10th. I think that's what the community needs. I think that there's clear guidance that schools should stay open to in-person learning. It's come from national, state, local levels, including our own medical advisors, and the cost of continuing virtual learning beyond this week is simply too great. So I guess I would just ask one more time for clarity that we are going to open our buildings to in-person instruction on Monday.
Motion to adjourn.
Well, I'd like to get that answer, or I would actually like to know when that's going to be announced.
Yeah, so Chris,
Yeah.
I think we've heard a few times that announcement will come tomorrow morning, but Dr. Jenkins, do you want to speak to that again?
I would just like to say the purpose of this meeting, you stated it eloquently, President Moultrie, and for us to be here, to hear from everyone, to hear from our community. And I think there was a sentiment across the board. I think I heard tonight, and we're going to chop it up a little bit later from the board members of wanting to open up on Monday. I think we heard from our medical experts. I think we've been working hard this week to ensure everything that we have to do, and we will make that announcement tomorrow relative to the formal announcement, as we had said in our cadence. One of the things I don't want to practice is when we say we're going to do something, we do something else. And I said to the community that Thursday, after we hear the updated numbers, and then we will come back out with a response to everyone about our intent to open up on Monday unless something happens. I think I said like it was only 7 something when I last said it, but now it's 8:52. And so that's kind of where we are with it. And to all those points that you also meant, we're going to open up, and this is why we feel like we can open and stay open. That's our biggest piece. I want people to know we don't want to just open. We think we can do it in a way. And Nama, I have to say it to you. Yes, communicating with students too, you all have it where we can communicate directly to you. And I don't think that's an issue with parents and being able to do that. I've done that before in the past. So thank you for raising that. And I hope that answered your question, Chris.
Yeah, thank you.
Board Member Pearson.
I second the motion to adjourn.
Nama, your advisory vote?
Aye.
All those in favor? Motion carries 7-0. Thank you all so much for your time this evening.
Thank you.